Let us pray. May we be inspired to serve, to support, to understand the persons who truly need our help. As we imbibe the services, the studies, and undertakings of professionals in the field of addiction. May ISSUP be blessed. May ISSUP be gifted. May ISSUP lead. May ISSUP serve. Amen.
Okay, good morning, ISSUP Philippines, and good day and good evening to all our friends from across the globe. I am Castillo, the Chair and President of ISSUP Philippine Chapter. ISSUP Philippines, with the support from the Bureau of International Narcotics and Law Enforcement Affairs, or INL, US Embassy Manila, and in partnership with the Dangerous Drugs Board, warmly welcomes you to our very first major virtual event for 2021. We're jump-starting the year with this pre-conference event with the hope to build interest and engagement among us professionals and practitioners in the field of addiction and behavioral health to join ISSUP Philippines' second national conference in June of 2021. So the world is in the midst of a most severe crisis in our time. The coronavirus pandemic has changed the landscape of everything around us. It's global in scale and massive in impact. The problem of addiction and mental health has taken an unprecedented surge. And as a network of prevention, treatment, and recovery professionals who are committed to continue to provide quality of care to people and communities we serve, awareness, knowledge, and understanding of these new challenges are key to better equip ourselves to respond with positive attitudes and evidence-based practices. Thus, our conference theme, Emerging Issues and Realities on Addiction and Behavioral Health Amidst the Pandemic, the Silver Linings of the Lockdown. We are very privileged to have with us the best in the drug demand reduction field coming from different parts of the world, and our very own national experts and organizations which promote evidence-based practices and programs. Thank you all for being with us here. We are truly humbled. Before we move on, let us get to know what ISSUP is all about. Let's learn about its vision, mission, and goals. Kat, video, please. Okay.
ISSUP is an international professional society that connects, unites, and shares knowledge across the global prevention, treatment and recovery workforce. Substance and drug use disorder are major global problems. There is enormous unmet need for effective prevention, treatment and recovery support worldwide. Across the world, clinicians, service managers, public health specialists, researchers, volunteers, families, communities, and civil society are working hard to help save, support, and improve lives through well-organized, effective, and ethical systems and services. Evidence-based prevention, treatment, and recovery programs and strategies offer huge benefits for individuals, communities, and society. However, there are many challenges and obstacles that stand in the way of providing effective practice. ISSUP is here to help. We connect. ISSUP members are plugged into a thriving professional network for sharing practical advice and knowledge across a wide range of themes and specializations. Our online community allows you to communicate with other members and share ideas, research, and resources. Our national chapters connect you with peers in your own country and bring national focus and context. ISSUP links you with our partner organizations, developing training or supporting policy making. And we can connect you with a network of universities delivering, developing, and promoting academic education within this field. We unite. Gain inspiration from your peers, learn and share ideas. Join online and in-person events taking place around the world. Access a wide range of online learning and training resources, including courses for the Universal Prevention, Treatment and Recovery curricula. We can also help you gain internationally recognized certification and credentials through our partners, offering you the chance to verify and share your achievements. We empower the field. We break down the walls that exist between research, policy, and practice by promoting the exchange of knowledge and speeding up the transfer of knowledge into practice to improve health, education, and economic outcomes for people and communities. Join us today for free by visiting our website and discover the benefits of ISSUP.
Is. So allow me to introduce what ISSUP Philippines is all about. Kat, please. Okay, ISSUP Philippines was born out of a common desire of Filipino addiction treatment professionals who have long been trained by Colombo Plan Drug Advisory Program through INL of the U.S. State Department to professionalize and unite addiction prevention and treatment practice in the country. We are a duly registered non-stock nonprofit organization with SEC since 2014. And our claim to fame was the very successful hosting of the first national conference in 2017 at the Novotel Manila. On August 5, 2020, barely 5 months ago, a new set of board of trustees and officers was elected. And as we transition to the new and next normal, ISSUP's strategic thrust to sustain our momentum are with 3 R's. We have reinvent, restart, and revitalize. Later on during the break, we will share with you our journey together as ISSUP Philippines is in the last 5 months. Aligned with ISSUP's global vision and mission, ISSUP Philippines was able to craft its own VMV in a strategic planning session held last 2014, way before ISSUP Global came into existence. Our vision then was by 2025 for it to be a premier organization of helping professionals of diverse disciplines in the field of substance use and co-occurring disorders prevention, treatment, and recovery. Our mission is to create a safe and nurturing platform committed to the highest ethical standards of practice, and then to provide access and training opportunities for the different curriculums of UTC, UPC, and now they're developing the universal recovery curriculums and credentialing and certification. To advocate for broad-based education and critical reforms that pave way for professional excellence, and to be a center for research and development on SUD prevention, treatment, recovery studies in the Philippines. We have also identified our core values, which are the basis for our rules of engagement. We have passion for excellence. We wear our passion on our sleeve, and integrity, firm adherence to the code of ethics of ISSUP in our own respective professions. Unity and diversity. We unite across all differences, mutual understanding, and harmony among diverse groups. Thus, our tagline for ISSUP Philippines is one in purpose, one in action. So for those who haven't registered yet as members of ISSUP, please do visit www.issup.net and go to the ISSUP Philippine chapter page. Thank you. Thank you very much. So at this point, allow me to introduce our speaker to deliver the opening remarks. Our speaker joined the administration of President Rodrigo Duterte in July 2016 as the Undersecretary for Public Order and later on as officer in charge of the Department of Interior and Local Government. Prior to that, he served as Police Director, handling Directorate for Human Resources and Doctrine Development of the PNP. He was also appointed as the PNP Special Action Force Director, which he held for 2 years. He is a graduate of the Philippine Military Academy in 1981, but studied electrical engineering at the Mapua Institute of Technology before then. From 1985 to 1990, he served as aide-de-camp to General Fidel Ramos, who was then Lieutenant General until he became the Secretary of National Defense. In 1999, he was Deputy City Director of Davao City Police Office, then became Chief of the Regional Personnel and Human Resource Doctrine and Development at the PNP Regional Headquarters. From 2005 to 2007, he served as a Director of Davao City Police Office. He retired from the PNP in November 2013 and was appointed as a Board of Trustee of the Public Safety Mutual Benefit Fund. In January 2018, he was appointed as the Chairman of the Dangerous Drugs Board. And ladies and gentlemen, to officially open our 3-day event, please welcome the Honorable Secretary Catalino Cuy.
Distinguished guest, Ms. Kelia Cummins from the International Narcotics and Law Enforcement Affairs, officials and members of the International Society for Substance Use Professionals, participants, ladies and gentlemen, good morning. It is a great honor and privilege to be with you virtually for the second National ISSUP Conference to discuss the emerging issues on addiction and behavioral health amidst this pandemic. First of all, on behalf of the Dangerous Drugs Board, let me extend my congratulations to the ISSUP for the conduct of this pre-conference. I am positive that this will help garner more attention and interest for the actual event in June this year. Last year has been an exceptionally difficult year for all of us. The toll of the pandemic has taken on the public's physical, mental, and emotional health, has made them more prone to drugs and alcohol use. I am thankful that there is an organization like ISSUP dedicated to spreading awareness and understanding about the drug problem, while at the same time advocating for quality care and treatment for drug dependence. Having a virtual session like this is extremely helpful in times like this because it allows us to congregate despite the restrictions and discuss these important topics. Last year, the Dangerous Drugs Board continued to implement programs under the Philippine Anti-Drug Strategy, or the PADS, through an entirely online manner. We resumed our partnership with different government and non-government agencies and advocates to hold preventive education, webinars, conferences, and meetings, among others. This just goes to show that even a global pandemic cannot hamper our desire to help our community and advance the government's anti-drug mandate. I hope that this pre-conference will be able to successfully focus on and cover all issues and best practices pertaining to these topics and contribute towards our overall effort to suppress the drug menace for the duration of the pandemic and beyond. Once again, thank you for inviting me here today, and may we all continue to work together towards our goal of having drug-free communities by 2022. Good morning.
Thank you, Honorable Secretary Catalino Cuy. Good morning, everyone. Now it is my privilege to introduce our keynote speaker, Ms. Kelia Cummins. Kelia Cummins is a tenured diplomat in the U.S. Foreign Service. Her previous foreign postings include Kingston, Shanghai, Islamabad, and Bern. Domestically, she has served as a watch officer in the Operations Center, and most recently as a special assistant to the Undersecretary for Management. Ms. Cummins holds a Juris Doctor from New York University School of Law, a master's degree in public health with a concentration in management from the George Washington University, and received her Bachelor of Arts degree from GWU in psychology. She speaks Mandarin Chinese and German. Prior to joining the Foreign Service, Ms. Cummins practiced corporate law in New York City. She is married and enjoys physical fitness and travel in her free time. Without further ado, ladies and gentlemen, Ms. Kelia Cummins of the Bureau of International Narcotics and Law Enforcement Affairs, U.S. Embassy Manila. Ms. Kelia.
Thank you very much for that warm introduction. Good morning and good evening to those joining from the US and other locations. Magandang umaga to the hundreds of International Society of Substance Use Professionals Philippine National Chapter members with us here today. On behalf of the US Embassy in Manila's Office of International Narcotics and Law Enforcement Affairs, also known as INL, I would like to start by congratulating the International Society of Substance Use Prevention and Treatment Professionals Philippine Chapter for organizing this pre-conference event and for proactively engaging several stakeholders with the goal of making prevention and treatment for substance use disorders accessible for all. This week's pre-conference event and the work on substance use treatment and prevention overall would not be possible without the assistance and contributions of the honorable guests with us on the line today. And I just want to take a moment to acknowledge them. Of course, from the Philippine government, DDB Secretary Cuy, PDEA Secretary General Wilkins Villanueva, DILG Undersecretary RJ Echeverry, PNP Drug Enforcement Group Head, Police Brigadier Ronald Lee. From the Department of Health, Dangerous Drug Abuse Treatment and Prevention Program, Dr. Bien Liabres. We have an honorable panel of guest speakers as well, including our global partners. I'd like to acknowledge them as well. Thom Browne, CEO of the Colombo Plan. Joanna Travis from ISSUP Global. Dr. Michael Miovsky, ICUDDR. Eric Siervo, CADCA. Olivier Lermet, UNODC. And our INL colleague, Brian Morales, based in Washington. And finally, of course, ISSUP Philippines National Chapter officers, board of directors, members, and supporters. On behalf of the U.S. State Department, Embassy Manila, and INL, we are thrilled to have been part of the preparation, planning, and execution of this pre-conference webinar series. I just want to talk to you today about a few things. One, a reflection on our shared goals and our efforts to date. And two, to look ahead at our vision for this week and beyond. The theme of this conference is very apt, appropriate, and timely. Emerging issues and realities on addiction and behavioral health amidst the pandemic. It goes without saying that these are unprecedented times. We find ourselves in the midst of a global pandemic, one of epic proportions that have not been seen in over 100 years. We find ourselves struggling with the new realities that all of this brings, from the more mundane challenges like figuring out how to log in today's session, to much more dire consequences, including loss of employment, challenging economic times, and the most serious consequence of them all, loss of life. But in spite of all of this, there is still hope. And this is a hope we strive together to bring via our work on this very important issue. Our work for people with substance use disorder has not been diminished with the threat of the pandemic. In fact, persons who use drugs have been one of the most vulnerable populations heavily affected by associated health risks, cessation of basic social services, limited social interaction due to community quarantine measures, and economic challenges. Our work, the foundation that we've worked hard to build in providing building blocks for a successful path to get us through these challenging times, will help ensure continuity of services for those in need. These foundational elements were established through many years of hard work and many contributions, but also through the vision and leadership of many of you with us on the line today. Today, we can proudly reflect on the work we've done to pave the way for the recent successes. INL has and continues to provide support for these crucial lines of effort, expanding drug demand reduction efforts through capacity building and resource provision in the areas of prevention, treatment, rehabilitation, and aftercare services. Our partnership with key national agencies, many of which are represented on the call today, along with technical support from our implementing partners, have made this work possible. We can also look forward to what we have yet to accomplish. There are so many ongoing lines of effort. We expect to see a rollout of the adaptation of a school-based prevention curriculum. There will be additional evidence-based training on modules of the universal training curriculum. And there will be also an expansion of our outreach and drop-in centers, which are important components of the treatment curriculum continuum. We launched a COVID-19 mitigation program recently to lessen the impacts of the pandemic on persons who use drugs and their families. We have programs aimed at strengthening the capacity and reach of our anti-drug abuse coalitions and many other lines of efforts that would be too exhaustive to list on our line today. But with all of these successful and beneficial endeavors, we can easily see that when we work together, we can get so much done for those who depend on our efforts. The strong foundation of support that we've established is a reminder of all that is possible. It gives us hope for the future and enables us to see the silver lining in the current crisis. A key partner in all of this, of course, is ISSUP Philippines National Chapter. And as part of the global ISSUP network, ISSUP Philippines is just one of 24 national chapters across the world, facilitating and ensuring that prevention and treatment for substance use disorder is accessible and available for everyone. For this week, ISSUP Philippines has prepared an excellent set of plenaries, presentations, and discussions to highlight emerging issues on addiction and behavioral health. The first and second sessions will provide both global and national perspectives, and the last plenary will focus on families and individuals affected by addiction and other behavioral health concerns and coping mechanisms for the pandemic. This week will also prepare us for the greatly anticipated second national conference. So I invite you all to actively engage. This is a rare opportunity to hear from world-renowned subject matter experts in the field of addiction science. Our experts come from all sectors, from law enforcement to education, public health, policy, local and national governance. We are truly fortunate this week. I'm very excited to hear from all of them, and I'm sure they will inspire us to dream bigger as we formulate and devise plans for our next steps in prevention, treatment, and recovery services. The possibilities are endless. Let's take this opportunity to share, discuss, learn, and succeed together. Again, congrats to ISSUP Philippines, and welcome to the pre-conference for all participants. Salamat at mabuhay, tayong lahat. Thank you.
Thank you, Ms. Cummins. Good morning, good afternoon, good evening, everyone. So excited to see all of you joining us for this pre-conference. At this point, I'll be introducing to you the first three speakers of our of this plenary one. Okay, so we start with our first speaker, Mr. Eric Siervo. He is the Vice President for the International Programs with Community Anti-Drug Coalitions of America, that's CADCA, in Alexandria, Virginia. In this capacity, he oversees the daily operations of CADCA's international programs and builds relationships to form strategic alliances with non-governmental organizations, government officials, U.S. State Department personnel, and other interested parties. In addition, he oversees CADCA's international training delivery system that deal with the development of effective community anti-drug coalitions that help communities develop population-level strategies to reduce substance abuse. He currently oversees implementation of training programs in 19 different countries on 5 continents and 7 languages around the world. Prior to joining the CADCA staff, Mr. Siervo served as a board member for the National Capital Coalition to prevent underage drinking in this District of Columbia. He also served the National Latino Council on Alcohol and Tobacco Prevention, that's LCAT, in the capacity of a program director. LCAT is also where he began his career in the substance abuse prevention. Mr. Siervo has several years of experience in project management, spanning across federal government agencies and non-government organizations. And I move on to our second speaker. Second speaker is Michal Miovsky, professor of the Michal Miovsky. I have to say that right. I don't want to. Okay, professor of clinical psychology in Charles University in Prague, Czech Republic. He graduated from the philosophical faculty of Masaryk University in Brno in 1998. In 2002, he received a PhD degree in clinical psychology at Plenary University in Lermet. In the same year, he was employed as a researcher at the Institute of Psychology of the Academy of Science of the Czech Republic. He has started his professional career as a volunteer and therapist in drop-in center and in school prevention in 1994, and later on he established therapeutic centers for drug users in 1998 and led a group of treatment facilities like therapeutic community, aftercare, day center, and substitution center in NGO Pedenbus in Brno from 2000 to 2002. He is the Vice Dean of Non-Medical Health Study Programs on the First Medical Faculty and Head Development of Addictology in Charles University and General Teaching Hospital in Prague. He led the creation or the establishment of bachelor, master's, and postgraduate addiction study programs of Charles University. He's the president of the International Society of Addiction Journal and deputy editor-in-chief of the journal in addictology that he established with his colleagues in 2001. And of course, Michal is the president of the International Consortium of Universities on Drug Demand Reduction, that's ICUDDR. And our third speaker for this plenary is Olivier Lermet. He is a senior resident policy advisor of UNODC Philippines. He assumed this post in the United Nations Office in Drugs and Crime here in the Philippines in September 2017. Before his appointment, Mr. Lermet was in charge of the Regional Drugs and Human Rights Program portfolio in Asia and in the Pacific, covering prevention, care, treatment, and rehabilitation of people who use drugs, and overall support to drug policy reform in the region. He has more than 25 years of international experience in leading health promotion, education programs, and criminal justice drug policy reforms. He has worked through Europe and the Balkans, Latin America, South and Southeast Asia, in various capacities, providing management and coordination support to national public policy development processes. Mr. Lermet also brings 20 years of technical experience in collaboration with high-profile government groups on drug policy and health in Southeast Asia. In previous assignments, Mr. Lermet has been in charge of presenting and managing UNODC in Cambodia and Nepal as country manager, where he advocated for community-based treatment initiatives. So therefore, you can see we have a very powerful set of speakers and with a wealth of experience, right? So may I call now our first speaker, Mr. Eric Siervo. Thank you.
Well, let's see here. There we go. Share my webcam. Okay, I think my camera's on now. Thank you. Well, it is a pleasure to be here. Well, this evening for me, but I know it's morning for many of you and afternoon. But it's a pleasure to be here, and I want to thank Malin for that warm introduction, and I also want to thank Teresita Castillo for the invitation and the opportunity to be on the panel this evening. I also want to take this opportunity to thank two very supportive partners that are on the panel this morning, Secretary Catalino Cuy and Kelia Cummins. Thank you for your support through the years, and it's a pleasure to see you both again, along with good friends and partners that we've had through the years that are on this panel. Particularly Dr. Michael Miovsky from ICUDDR, Olivier Lermet from UNODC, Joanna Travis Roberts from ISSUP, along with Brian Morales from INL, and Thom Browne from Colombo Plan. It's great to see everyone. And again, thank you for the opportunity. And let's see.
Eric, excuse me, we can't see you. Your video isn't on. There you go.
Okay, there we
see you. Thank you.
Sure. It looked like it was on my end. Okay. Perfect. And will you be sharing the presentation? If you'd like, I could share the screen. I have a presentation for today. But while I guess that's being queued up, let me tell you a little bit about CADCA, Community Anti-Drug Coalitions. As you've heard, we work specifically to develop safe, healthy, and drug-free communities. CADCA does this by strengthening the capacity of local communities to form coalitions, to create and maintain safe, healthy communities. And CADCA was formed from a presidential drug advisory council back in 1992 and represents over 5,000 community coalitions across all 50 states of the United States, U.S. territories, and we're present in 28 countries around the world, where we've also developed community coalitions, including the Philippines. And we're able to accomplish this by assisting local communities through providing training, technical assistance to develop effective multi-sector community coalitions. And I just want to check real quick. Are you able to see my screen now? Let's give
Yes, we can. Thank
fantastic.
you.
Thank you for that. And so we're able to do this by, as I mentioned, providing training, technical assistance, and support to communities to develop effective multi-sector community coalitions capable of achieving population level reductions in illicit drug use and related problems. As I mentioned, we've been working now for some time with INL to recreate and adapt the coalition strategy to communities around the world. And as I mentioned, we have a network of coalitions in 28 countries where we've developed over 300 outside the United States. And our work internationally mirrors our domestic work to offer training, technical assistance, and resources on a wide variety of strategies related to community coalition development. We offer this to government institutions, non-government organizations, community groups in numerous countries affected by the cultivation, trafficking, and use of substances. We train communities essentially to determine local actionable data to develop, implement, and evaluate strategic plans while building capacity through mobilizing communities through civic engagement. In short, we help communities form multi-sector coalitions by recruiting and organizing youth to speak publicly about local drug and alcohol misuse issues, working with local authorities, and assume the responsibility of taking action and be agents of change in their respective communities. Up until March of 2020, we used to accomplish this by traveling to countries and offering trainings face-to-face. But since that time, that hasn't been possible. So we have had to, as a result of the pandemic, find other ways to provide support to communities around the world, and that's been made possible through virtual outreach and establishing new ways of reaching communities through taking our signature events to web-based, through virtual meetings, webinars, and online training and technical assistance, one-on-one coaching sessions with coalitions, and even creating the opportunity to have a regional or national network engagement activities where coalitions themselves can also share their best practices and lessons learned during the pandemic. And I just want to talk a little bit about our reach in this time. We've been able in the United States to reach 14,000 adults and youth trained in all U.S. states and territories. We've reached and trained directly over 270 coalitions domestically. We also have a lot of outreach activities we do domestically to train communities around the country and in the territories. And one of the ways too we hit these big numbers, we have big signature events. Next week, for example, we have our 31st National Leadership Forum. We have over 150 workshops taking place next week and over 3,000 participants that'll be in attendance. So that's some of the ways we have a couple of those signature events that help us reach over 6,000 people in just those events. but also the work that we've been doing around the world. We've been developing virtual country plans with our country partners to meet communities where they are and provide tailored technical assistance and training. And we've managed to accomplish over 566 instances of outreach activities, and we've trained over 4,600 community leaders around the world through webinars and those regional events and consultations that I mentioned, along with technical assistance. And as we've been doing this engagement during the pandemic, it's not all roses. There's a lot of challenges out there, but we have found that our coalitions, many of them have been able to evolve and adapt to the new environment, and others who are in the process of reactivating. They're still meeting regularly, but it's been the getting back out and doing activities, engaging in community change, and what that looks like in this new reality are some things that some coalitions are still working through. And there's also another reality too. We find in many cases coalitions that have become inactive, and again working with those communities again to get mobilized and organized, and to adapt, adopt, and reprioritize and re-strategize in this environment. And some of the things that we're finding as we've had this engagement with our community coalitions around the world is that, typically when there's a kind of a crisis or a disaster, whether it be an earthquake in Mexico or Syrian refugees fleeing to neighboring Iraq, where we've had coalitions in the case of emergencies like that. And we have all these groups that represent the local system and infrastructure, where you have decision makers, people that represent the capacity locally to deliver services. And through a coalition, they develop plans and strategies and execute them, and we equip them to do this around substance use. But in these times of emergencies, we find that coalitions are able to adapt quickly and shift priorities to serve those greatest needs in the community. However, during the pandemic, we've never seen this in every country and every community around the world. And we're finding a lot of similarities in terms of, while they've been shifting priorities, the types of gaps that they're trying to fill for vital services. It doesn't matter whether you're in the United States or in countries like Senegal. There's a real need. People are hungry. They've lost their employment and their wages, and it's hard to put food on the table. And coalitions have been setting up food pantries and food drives to get food out to those who are most in need in their communities. But whether it was a food drive, in many cases, they've also been part of the local COVID response. Here in the middle, we have a couple of pictures from Tajikistan and Senegal, where coalitions have been disseminating posters, working with their local and national governments to get the word out on national COVID guidelines. In the end, we have coalitions in Indonesia who've been collecting and distributing PPT. We've also seen this in the Philippines and in countries around the world. And right here in the Philippines, for example, we have a president of the Association of Anti-Drug Abuse Coalitions, Chairman Dr. Raquel Tolentino. She reported to us early on that even back in May, coalitions have been coordinating their efforts with partners, including the local medical sector, the COVID task force, and other government agencies to contribute to the drafting of COVID guidelines and local drug prevention action plans. And while keeping a focus on substance abuse, helping with filling the gaps in these services. But in addition to filling gaps in social services, coalitions around the world have found themselves really finding that prevention has an expanded scope for them during the COVID-19 pandemic. It's all the disparities that have been surfaced. It's not just about substance abuse these days. You really see just how intense the issues, and go figure, the risk factors are interrelated, and as well as the consequences around mental health, suicide, COVID-19, as I mentioned before, the hunger, loss of employment, and the other social and public health issues that are associated with the pandemic. And as a result of this, as coalitions have been keeping a pulse of what's happening in their community, they're also seeing how these realities and the conditions on the ground are changing. as a result of to some of the things that they're seeing. So for example, in countries like Argentina and Uruguay, coalitions are reporting increase in marijuana cultivations as a means for people to supplement loss of income. In Kenya, we have coalitions reporting increase in substance use, domestic violence, as well as teenage pregnancy, the impact that all of this is having on youth, especially around school closures. You know, as a result of these things, coalitions have had to examine, kind of take an internal look at themselves, re-examine and enhance their capacity in response to the changing conditions on the ground. As a result, we've got some images here of some of the opportunities, though, that have started to come out of this, where we've had coalitions reach out to local experts, whether it was in Uruguay, for example, here, or in Brazil, where they've reached out to psychologists and psychotherapists to, you know, have sessions that typically you might have seen in a conference, and, you know, we're all retrained to have meetings and do these kinds of events online now. Kind of breaks down barriers, but we've seen coalitions have sessions and workshops on prevention and social change during the pandemic, the impact of substance use families during COVID as well. And it's not just even about coalitions examining and enhancing their own capacity, but looking at the sectors that make up their coalitions and how to also support those sectors with the needs we have. So this image to the far right says Breathe Urcos. There's another campaign, Breathe Waru, which are two cities where we have coalitions in Peru. And they've been raising money for their local health centers so they can purchase oxygen tanks for COVID patients who can't breathe. And so these are some of the ways that some of the realities that we're seeing in this changing environment. But one of the things that I want to talk about now are some concrete examples of how coalitions have evolved and how they're staying focused on substance use prevention and how they're reinventing themselves during the pandemic. So briefly, I want to mention, since we're in the Philippines, I thought it'd be fitting to start with the Philippines, the Aklan Community Coalition on Drug Abuse Prevention. During the pandemic, this coalition has completely reinvented itself, ramping up its presence online through social media and using online platforms. For example, they did several campaigns and contests around Drug Abuse Prevention Week. They supported that event and raised awareness around drug abuse prevention by managing several online competitions, such as spoken word, poetry competition, graphic design competition, and among other things, they've also, working with their local municipality, launched a TV show with local media and the local municipality, which covers topics from local ordinances around safety and security to COVID policies and local responses to the pandemic. Also during this time, this coalition also co-authored, lobby, and passed a local ordinance for workplace drug testing, which includes public officials, government employees, public, private workers, private organizations, NGOs, cooperatives, and associations. The Aklan Coalition was also instrumental in setting up a substance use committee for the entire province of Aklan. Now, I have to tell you, if you want to know more about this, there's a whole 15-minute video that is fantastic. These are essentially my notes from their video, but they go into very great depth and detail about what they're doing. I cannot do it justice with the time that I have here today, but if anybody's interested in learning more, not just about the Aklan Community Coalition on drug abuse prevention, but the other 26 community coalitions in the Philippines, they can reach out to myself or Dr. Raquel Tolentino, who's the chairman of the coalition movement, for more information. Also, I want to speak briefly about Central Asia. We have here, for example, the Karanga Coalition in Kazakhstan. Prior to the pandemic, they had discovered graffiti in their community that was actually linked to a website to purchase synthetic drugs. When the lockdown came down, they weren't able to finish their environmental scan, so they took to social media and did an environmental scan challenge. And through social media, they were able to collect approximately 70 photos of 70 different locations where this was being advertised in the community, and working with local government, they took measures to remove that and create a barrier for the purchase of synthetic drugs in their community. The Caracol Community Coalition during the pandemic was also worked in collaboration with a local government to conduct an online survey of the youth, specifically surfacing information on drug use, access to drug, perception of drug use among youth. And this is an area of the country where they knew there was cultivation of marijuana, but they didn't know the extent to which youth were using. And this survey reached over 1,500 youth, and the findings were that 16% of youth had indicated that they had used marijuana. So with this new information, now government officials, people are mobilizing around this issue, and it's helping to drive the plans and strategies moving forward for the actions that they want to take to address marijuana use. I'll also say too that in Peru, we had a community coalition in El Indio that's up in the mountain, in the Andean region of the country. Prior to the pandemic, they had a real problem with the use of cocaine paste, which is a crack cocaine derivative that's very cheap. And it was particularly sold and used in a park. Well, since the pandemic, that park's been closed down. But what they have seen is a behavior change that occurred where residents are drinking alcohol in public, on doorsteps and sidewalks, in stores, or what they call chicheros. Chicha is a type of illicit alcohol brew. And as a result of this change in behavior, they've seen an increase in assaults and delinquent behavior, as well as greater spread of COVID-19. Castillo is one of the districts with the highest rates of infection and death, but it was also a victim of disinformation campaigns where, basically people were under the belief that they were protected from COVID as a result of alcohol use. So since then, the coalition's carried out various activities to get the word out on the risks of alcohol consumption through putting up signage in the community, getting out to radio, working with the national police, and taking on a whole lot of awareness campaigns. But they also are moving to pass new laws around prohibiting the use of alcohol in public spaces and limiting the sale of alcohol. And I'd also say briefly that in Brazil, our coalitions there, some of the ways that they've been able to innovate had to do with youth trainings. In the past, they were limited to reaching about 7 schools. But since they're youth that do most of these youth leadership trainings, they've now been able to reach a lot more youth and many more communities. And I know I'm running out of time, so I'm just going to wrap it up here by saying they've also taken to developing an online questionnaire and doing their community assessments online. But an opportunity that's come out of this is that coalitions are working with universities to develop a standard form, and they're going to be collecting data from multiple communities during the pandemic, which they plan to have tabulated by April. And so I'm going to wrap it up there. I had a little bit more to share around the United States, but out of respect for the rest of the panel, I'll stop there. And I just want to thank everyone for their time today, and for ISSUP for this opportunity to really take a step back and reflect on all of the things that we've done. It's a lot to package in 15 minutes, but I at least wanted to leave all of you with the depth and breadth of what we're seeing and what community coalitions are doing in various countries around the world, as we're all certainly dealing with similar issues as a result of all the health disparities that are coming forth as a result of the pandemic. So thank you very much.
Thank you, Eric, for that wonderful presentation and the work that you have done over the world, particularly in our country under the leadership of President Tolentino. Thank you very much. So now, yes. And now we would like to present our second panelist from Charles University from Prague, Dr. Michal Miovsky.
Dear colleagues, ladies and gentlemen,
Dear
I would like
colleagues,
to thank
ladies
you
and
for giving
gentlemen,
this
I would like to
opportunity
thank you for
to
giving this
present
opportunity.
some of our results and concerned what raised in connection with COVID infection. And maybe some of the topics what I will mention and I will speak about are a little bit far from the everyday work, but on the other hand, long-term impact of our work, what is based on producing and facilitating developing of workforce are visible, and at the same time in these days, in these times, it looks much more affected than we expected before. First of all, I would like to express my special thanks also to our Philippines friends for organizing this wonderful event and delivering this information and sharing this information with other colleagues from different states and regions. I'm representing ICUDDR. It means International Consortium of Universities on Drug Demand Reduction, and in this context, we are not only representing universities, but also service providers and bridging the space between service providers and training and educational institutions. Addiction specialized institutional infrastructure is much broader concept than just treatment and prevention services. And it implicates automatically higher vulnerability and potential negative impact of COVID infection on sustainability and stability of our field, addiction field. I mentioned in my former presentations that developing of specific institutional infrastructure is very difficult and long-term process, longer than 150 years, and it has started in the US and Great Britain, and it's about exponential growing of institutions in this field. It means institutions specifically dedicated to addictions and addiction issues. I mentioned at the beginning that we are not talking only about prevention providers, service providers, treatment providers, but also about something like superficial levels, something like very special kind of institutions develop for this purpose, for helping and supporting our real clinical work. We are talking about addiction research centers, about addiction specialty journals, about addiction-focused professional societies, libraries, and at the end also about specific education and training programs and providers. The exponential growing of these institutes was pretty fast, especially in second half of last century. And we can find exponential growing of addiction specialty journals. What is the first picture? The second picture is about exponential growing of research specialized centers. The same situation we can find in terms of number of society, professional societies around the world at the national and international level. And the last picture, what is on the right side, is about addictions specialty libraries. And in connection with libraries as the most vulnerable institutions in terms of dependency on financial contribution and help, we could see the situation 12 years ago that some of these institutions had a big problem related to the financial crisis raised in 2007 and 2009. That inspired me to do a very simple case study. But before, I would like to summarize it, that we can talk about very colorful picture of different institutions, and in the middle you can see service providers in the area of prevention, treatment, and the public health interventions. On the left side are self-help and patients activities, and on the right side are institutions and institutional tools like journals, research centers, professional societies, and other kind of bodies. And drug services are generally relatively new in the system. It means that in many countries have these services problem with sustainability because of implementation issues. It practically means that we can find lack of institutional and legal background. It means that usually these services are separated from normal health and social system, and usually in many countries we can find troubles in integrating these services into the health and social care system. It means that drug services are usually linked to special financial mechanisms like governmental grant system. And it means that these grant systems and this specific governmental support is usually affected more significantly in times of financial instabilities, like last financial crisis 12 years ago, or right now upcoming financial crisis induced by COVID infection. And last but not least, we can also find growing stigmatizing issues, because if you have no enough money in the system, usually these issues are growing and having significantly more higher impact on society. I mentioned that these troubles 12 years ago inspired me to do very simple case study. This case study is available on my ResearchGate profile, and you can download it in full text. And it was analysis focus on public health intervention in Central and Eastern Europe, where we can find a very negative impact of last financial crisis on financial mechanism and governmental support of this group of services. And the impact was really huge. And we are afraid and concerned that this impact can be repeated in connection with impact of COVID infection, and not only in Europe. It can be broader and phenomenon what can be find and recognized also outside of Europe. As I mentioned before, university academic degree programs are very special kind of institutions, and in terms of programs specifically dedicated to addictions, we are afraid of their specific vulnerability. And my concern is about impact, a real impact on this program in many countries. We can recognize and we can find one critical paradox. Exponential growing of academic study programs with special focus on addictions was significantly linked to better economic situation in the area of service providers. It means that exponential growing number of service providers drives need for academic programs and highly educated professionals. But it also means that financial troubles in this area of service providers have a potential negative impact on universities and university education providers. That's logical consequence. There are no enough that's our expectation, that there will be no enough working positions for people graduated from the specific programs, and it means that these programs can be affected. The paradox is that despite of all epidemiological trends represented by higher prevalence of drug use, including alcohol and tobacco, what is logical consequence of COVID infection, and we have enough evidence about it, we have to deal with negative middle-term impact on universities with academic degree addiction study programs. And I think that we should to talk about it and prepare for this negative trend, what is probably upcoming. The impact can be on all kind of key university products. I mean, specialized training and education programs for undergraduate students. We can speak about summer and winter schools, comprehensive academic degree programs, and also for lifelong education, training and education programs. The more important than these products is number of universities what can be affected by this phenomenon. The first study what I presented on former events was a simple Google survey in Europe, and we have 34 programs, university programs in this category in Europe. You can find almost 400 university programs in United States and Canada. And last survey was focused on Africa, where are located 6 university programs in this category. And that's number. That's something what is significant, and that's something what we should to consider. The key question is, what's the challenge for ICUDDR and our partners like ISSUP and other partners? In my eyes, it's about following our key goals, following our purpose. The first and number one issue is sustainability of regional centers. And for instance, in Asia is coordinating center on Mahidol University in Thailand. And I think that sustainability of these centers in every single region is a critical issue to us, because it's about monitoring what is happening, what is upcoming, and at the same time, and that's probably the most important thing, about exchanging our experiences, how to provide these practical lessons and how to improve our reaction and effectiveness of our reaction. The second point is how to use and how to respond to this epidemiological situation and population trends. And I think that this is probably the best way how to engage students for these specific university programs. Last but not least, we should to speak about advanced research in education and education projects. In many countries, we can see ongoing research projects. What is probably the best way how we can prove our purpose and our function? This is only one example. What is a project shared by 29 countries, focus on alcohol use and impact on alcohol use by COVID infection. And I think that we can find many studies like that around the world. How we can use it? One side is practical impact of our results and our work. On the other hand, it's perfect opportunity to demonstrate the function and additional value related to higher educated addiction professionals. And I think that we need to systematically link this issue with academic study programs, because it's about justification of this program and its contribution to advocacy work for this institutions and study programs. We have very practical tool. Just recently, we have developed collaboration with International Journal Addictology, and it means that we have academic space for showing, sharing, presenting our results in this area, and results from these first studies focused on COVID infection and its impact on addiction field. When I will summarize my presentation and try to express very simple things, what are consequences of all this phenomenon, monitoring drug services and impact of COVID infection on these services, drug services, is essential and represents critical area of potential impact of upcoming financial difficulties for these services and related labor market. We can expect a negative impact on developing labor market in our field, and it's problem for highly educated addiction professionals, what is completely opposite to a real need of these specialized services for people with substance use disorders and ongoing epidemiological trends. It means that despite the fact we need more professionals in the field, we will have probably problem how to support and proceed with our work on capacity building. COVID infection probably brings practical lesson. What is the function and purpose and the need for specialized addiction services, especially in this time of crisis, because of growing number of people dealing with alcohol, tobacco, and other drugs. But we need to demonstrate it. It means make it visible and to have enough robust evidence about it. And last but not least, as I mentioned before, we also need to work with available evidence for practical reasons. And it means that we need to demonstrate this national and international level of collaboration. And in parallel with it, it's not about practical help and support to our governments and governmental institutions. It's also about demonstrating our academic skills and potential, what we need to make available and more visible towards broader academic community. I think that it is about a really interesting opportunity to show what we are and present what we are doing and what's our purpose. On the other hand, I think that we need to consider all of these consequences and difficulties what are upcoming in terms of COVID infection. Thank you very much for your attention. And at the end, I hope that you will have a good and fruitful time. And thank you for organizing this event and providing this opportunity to all of us for sharing these experiences and sharing this knowledge. Thank you very much and have a nice day and have a good time. Stay safe.
Thank you very much, Dr. Miovsky from Prague, and the learning that we have heard from you and the experience of various universities all over the world. Thank you very much once again. And to our third speaker for the first part of this pre-conference this morning, we would now like to call on Mr. Olivier Lermet from UNODC. Good morning.
Good day, everyone. Morning, afternoon, evening. It's really a pleasure for UNODC to join that very interesting effort. So we would really like to thank ISSUP, of course, but many others that did contribute to this. So in the interest of time, I've been kind of shrinking my presentation a lot. So I won't talk too much about UNODC. Of course, UNODC works on many issues, human trafficking, corruption, terrorism, criminal justice as a whole, and I could go on and on. But of course, we have a very important drug-related engagement globally, regionally, and in the Philippines, where we have a significant portfolio and a growing and vibrant team to support the partners in the country. Partners being National also Dangerous Drug Board, Department of Health, local government, civil society. Most particularly in the Philippines, we are supported notably by a number of US government supported initiatives. The USAID Renew Health Drug Demand Reduction Program, one initiative from precisely on addressing the nexus between substance abuse and the COVID situation, and we engage with many partners. But I just wanted to mention notably today the Colombo Plan and of course ISSUP. Looking at the presenters, and this was confirmed by the two excellent presentations before, and the panelists, I kind of humbled myself and thought that maybe I should not present what I would normally do, which is a presentation setting the ground on drug demand reduction, the principles of drug treatment and prevention in the COVID context. I saw that maybe I would try to do something different, trying to possibly mention things that hopefully other speakers would not mention. So it's a little bit of a gamble, and my presentation will therefore not be that flowing, right? It would probably look like a non-conventional patchwork or potpourri. So if it is okay, can you put the presentation, and maybe I will just cut the video while I present and then put it again, okay? So I cannot see my presentation right now. I will cut my video, okay? Okay. So as I was saying, the PowerPoint, due to time constraints and also the presence of so many good participants, and I didn't mention presenters later during the conference from USEC and Dr. Benjamin Reyes from DDB, our boss of the prevention and treatment and reduction section in HQ. So I'll try to go more regional and national, and try to list a couple of determinants to a good drug policy and a good way to address substance abuse. So first slide, next slide, sorry. Okay, so this one is not COVID related, but I think it's just a striking graphic way to see what is the substance abuse problem we are facing in the region, right? So 2010, we have a couple of countries that are reporting methamphetamine as a primary drug of concern. 2019, it's all blue. This has become the public health and public security drug of concern in the region, globally also, but especially in our region, which accounts for about half of the users in Asia, half of the users globally. Next slide. And there you can also see the trends, right? You can see how methamphetamine seizures have increased while the cultivation of opium decreased. That doesn't mean that heroin is not an issue, but compared to 20 years ago, where the Golden Triangle was the epicenter of the problem, methamphetamine, ice, shabu, as it's called in the Philippines, is clearly the main problem. Next slide. Okay, so what appears, according to a lot of information that we have collated, is that the COVID-19 has not impacted so much the synthetic illicit market. It has adapted. Yes, there are changes, but basically, and we will see that later, the business is still growing, and the criminal rings have found ways to adapt to the new situation, whether through border crossing, like in the Mekong, some Mekong region, or even through other ways, maritime and others. Next slide. And just to illustrate the flexibility of the criminal networks, and to illustrate what is usually called the balloon effect, right? In 2013, there was a major epicenter of production and trafficking in China. What just happened is there was very strong law enforcement operation that just triggered these organized crime groups to relocate a major production site to northern Myanmar. Next slide. And this was, of course, that relocation in Shan State in Myanmar. Shan State was picked because, of course, of the presence of armed groups that are not under the control of the central authorities in Yangon. So there was a connection with some sites in Thailand, and then the production has been dispatched to all the region, not only the Greater Mekong, but broadly the Southeast Asia. And even within that period, you can see the mobility. If you look at the Thailand situation, between 2018 and 2019, you can see that they are capable of moving extremely quickly, especially because, of course, methamphetamine are not a botanically grown drug. So it's easy to locate the production close to the consumption center or the transport route. Next slide. And according to our data, the amount of seizures keep increasing just before and after the COVID situation at a pace that is impressive, right? Every year is a new record year in each country on methamphetamine. And if there were some little difficulty in adjusting to the COVID environment at the beginning of 2020, they have already recovered and making up for the losses during the first quarter of 2020. One hypothesis is also that the law enforcement has been focusing so much on the restrictions related to COVID that possibly that gave more space for those illicit activities. Next slide. So this is a slide that is showing that you have the previous rules and the emerging routes, and it keeps evolving, whether land routes or maritime routes or via airplanes. Next slide. Another interesting element is the fact that the price, despite the campaign against illicit drugs, despite the limitation of COVID, the prices keep going down, which is also a sign that availability for people who use drugs is still there. Next slide. And another proxy indicator of the availability is the purity of the drugs, and the purity is also increasing, meaning that apparently the drug demand is still pulling the market, and regardless of the obstacles, the business is still growing. Next slide. So this is also important that we are in a region where the interconnectivity is increasing, which is excellent in terms of trade, employment, etc. But that also means that the interconnectivity of the criminal rings is facilitated. So you have a new alliance with non-typical major drug rings. Some kind of joint venture at the national level between transnational groups and local groups, training of chemists, notably from Chinese chemists, and an adaptation to the migration of population. And the phenomenon of the growth of casinos is also interesting. I will talk about it later. Next slide. And this is just an illustration. So you have one of the way to move meth across countries is to put them in fake tea bags. Those are several of the brands that are used. But there is another one that is even so famous that every custom officer knows that. But for the criminal rings, they don't care, because they are. It's also a way to show their their power. They don't care about losing a couple of tons because what they are pumping out is so big. Next slide. So just, of course, this is the nerve of the war, as we say in French, the nerf de la guerre. The business is absolutely out of proportion, just based on what we have been able to collect through our transnational organized crime assessment. The market is about 60 billion USD in this region, which means it's bigger than the national budget of many of the countries, of some of the countries. Next slide. Here you can see what I was mentioning earlier. There is an incredible growth of casinos that are generally connected to special economic zones and zones of production of methamphetamine. This is an impressive factor, and it is very, very clearly connected to money laundering. We have seen a number of crackdowns in Macau, China, and we can see that also through the US Treasury sanctions on the one Cuy. Next. The scale of trafficking is increasing, not only methamphetamine, but a variety of synthetics, some of them with real public health concerns. Organized crime evolving and thriving. And I'm sorry for the noise. The need for law enforcement to adjust to that situation. Next. Now I just wanted to say a couple of words on the nexus between the drug phenomenon and the criminal justice system. First, basically there is a lack of personnel to handle the cases and the investigation, and the majority of justice officials lack the capacity to still properly oversee a case through its entirety, and they don't most of the time master what drug dependence means, what the public health approach means. The result of this, plus the level of criminalization of drug use, is the following. Next slide. We have a very, very high level of overcrowding in the prison system. This is not unique. We have a prison crisis globally, but our region is particularly characteristic of that. And also one of the issues is the big bulk of the people locked in prisons are pre-trial detainees, meaning innocent until proven guilty. And you can see that, and also another imprisonment, incarceration of women related to the drug cases. And this is particularly true in the Philippines. The Philippines is actually the most overcrowded prison system. Next. Next again. And another issue we have been facing is there has been a limitation to release pre-trial detainees for alleged non-violent crimes with a precarious health condition to be released out of prisons. That's an issue that should be worked on, because as the different waves are going to come, it's inevitable that COVID makes its ways big time in the prison. And as much as there are guidelines about how to handle isolation in the prisons, the level of overcrowding makes it very difficult. Quickly, because I understand I am reaching the end of the presentation, just to remind that the countries have been discussing the right ways to deal with the drug problem and this has been collated during the UN General Assembly special sessions on the drug problem and the operational recommendation. I won't go through them because I think I may have exhausted my time already, but basically there is an agreement that there is a need to significantly boost the people and health-centered response, which means all the gamut of drug demand reduction being perceived as addressing a complex multifactorial health disorder, and addressing cross-cutting issues related to key population, women, youth, and the criminal justice aspects. And as far as drug demand reduction is concerned, as far as drug supply is concerned, there is a need to have a better linkage between the drug law enforcement sector and the health and social welfare system, and also for the supply reduction system to focus on the big criminals. And for this, a need to basically follow the money trail, money laundering, corruption associated with drug trafficking, and different techniques of law enforcement that makes it more sharper. Please now, as I am late in the day, can you scroll down to the slide number 26? Okay, so no, that was the right one. Yes, just to mention that there are a couple of very good initiatives to address this in the Philippines. First, we have the Philippine Anti-Illegal Drug Strategy that was issued through an executive order of late 2018. This includes a whole section on drug demand reduction, which is basically matching all the international standards that I was mentioning earlier. Community-based drug rehabilitation has been initiated through a number of guiding documents. Here I mentioned one that we particularly supported in 2015-16, but then the efforts have been continuing with a number of partners. And what you can see there in the small chart is about the client flow. This is an extremely big achievement for the Philippines, basically giving a proper way to assess the people that have been identified as drug personalities, as per the local terminology, and assessing the level of dependence, and then orienting them to the proper services, which in most cases, in fact, are voluntary and community-based drug services. So I am sorry if the presentation was a little bit funky, and I've tried to cover several angles, and I guess it's time for me to end up. So thank you a lot. Oh no, sorry, just three short aspects. First, because there is a silver line. The first one is an example. We've been supporting the local government and the local anti-drug abuse committee, right? That are part of the local government that in a way complete what Eric was describing earlier. Well, we have examples where a number of recovered drug users have been paid decently and used as a paid volunteer to be the frontliners. So there were those who were distributing food to different parts of the countries, including the slums, for instance. And I think it's a very good example on how the people who use drugs or the people at risk of using drugs are not only a problem, they are also part of the solution. The second aspect I wanted to insist on is also the efforts related to prisons, which also that has been supported by INL, by the way. The importance of the prison sector and the incredible stress and the work of the prison staff and the people deprived of liberty. They are in the same ship. And my last thing is a little bit, it's a personal example. My wife, who ironically happens to be a doctor and working on COVID containment for UNICEF, got COVID and was hospitalized she was with my in-laws in Central America. So she got COVID, she was hospitalized, and she went through it. And I guess many of us have been affected more personally by COVID. COVID are not just statistics. I just wanted to say again that it's important to give credit to the doctors, the nurses, the paramedicals, and many other professions, like for instance, the people in the prisons, because at the beginning of that epidemic, at least in Europe, at 8 p.m. in many countries, we were all clapping at the balcony to give, to credit them for their incredible efforts to address that horrific pandemic. Well, after the second wave, it seems that people tend to forget that a little bit. So I think, well, we need to be happy with the incredible work of many of the frontliners. That is it for me. Over, and thank you, everyone.
Thank you very much, Mr. Olivier Lermet from the United Nations Office on Drugs and Crime based in Vienna, Austria. Thank you for gracing this, and we learned so much from you and the support that you have been giving to our Philippine counterpart. Thank you very much. So now we will have a 5-minute break to sort of clear the air, gather all the information that we have heard from our first 3 distinguished panelists. And we will continue after 5 minutes with 3 others to present the worldwide situation, the global perspective. Thank you. Thank you once again, Mr. Lermet. This is a call for volunteers to leadership roles for the ISSUP Philippines chapter, where last year we reorganized ourselves to a new board of trustees, and this year we would like to invite anyone here listening and friends of ISSUP to volunteer. Please continue to read on the slides that we have prepared for you. One can join ISSUP through issup.net, and you may now apply for membership in the Philippine chapter in the national chapter page. And there are 5 different committees which we have identified where your desire to help may be useful for those who need our assistance. Those are membership, programs and events, corporate affairs, ways and means, ethics and governance. We would like to receive them this month. Please do send your CVs to Chit Castillo on the email address chit@isuphil@gmail.com.
starting out on a journey, never dreaming what we'd have to go through. Now here we are, and I'm suddenly standing at the beginning with you.
No one told me I was going to find you. Unexpected, what you did to my heart. When I lost hope, you were there to remind me this is the start. And life is a road and I want to keep going. Love is a river I want to keep flowing. Life is a road now and forever, wonderful journey. I'll be there when the world stops turning. I'll be there when the storm is through. In the end, I want to be standing at the beginning with you.
We were strangers on a crazy adventure,
Never dreaming how our dreams would come true. Now here we stand, unafraid of the future. At the beginning with you. And life is a road and I want to keep going. Love is a river I want to keep flowing. Life is a road now and forever, wonderful journey. I'll be there when the world stops turning. I'll be there when the storm is through. In the end, I want to be standing at the beginning with you. Knew there was somebody somewhere. Let me love in the dark. Now I know my dream will live on. I've been waiting so long. Nothing's gonna tear us apart. And life is a road and I wanna keep going. Love is a river I wanna keep flowing. Life is a road now and forever, wonderful journey. I'll be there when the world stops turning. I'll be there when the storm is through. In the end, I wanna be standing at the beginning with you. Life is a road and I wanna keep going. Love is a river I wanna keep going on.
starting out on a journey.
Life is a road and I wanna keep going. Love is a river I wanna keep flowing. In the end, I wanna be standing at the beginning with you.
Wow. Warm greetings to all. I hope the wonderful video put together by no less than our chair and president, Chief Castillo, makes you feel energized and inspired as it does for me. So folks, we urge you to actively participate by posting your own comments and questions in the questions box, which we've been monitoring since we started. And I do, friends, agree with Malene when she said we certainly have a powerful lineup of speakers sharing their global perspectives on the emerging issues and realities on addiction and behavioral health in the midst of the pandemic. I am most interested to have a bit of a discussion, and given the questions that are coming in, to note where the silver linings are. Following the high-performing lineup of experts we just heard, our second set of speakers is a virtual who's who. ISSUP's dynamic Chief Executive, Joanna Travis-Roberts, has worked in the substance use disorders field since 2001 in a variety of capacities. Her educational background is around literature and languages, with a postgraduate specialization in marketing. Her professional life has encompassed a wide range of responsibilities around research, communications, event management, and leadership. On international platforms, Joanna has consistently worked to engage an international audience, as that we have now, in quality standards and evidence-based practice. In fact, her personal mission has always been to use communication and marketing skills and experience to ensure organizations like ours communicate effectively with their audiences to make knowledge and resources as accessible and therefore effective as possible. In this way, she's working hard to make ISSUP both accessible and effective for its wide range of users and members. She will be our first speaker to share her global perspective. Brian Morales is the chief of the Counter-Narcotics Branch of the U.S. Department of State, working with the Bureau of International Narcotics and Law Enforcement Affairs, Office of Global Programs and Policy, or INL-GBP. He oversees two units, the Drug Demand Reduction and Drug Supply Reduction, focused principally on synthetic drugs. He has worked on the issues of substance use prevention and treatment for 12 years, developing and implementing projects with countries in Asia, Africa, and Latin America. In his missions to over 80 countries, Brian has collaborated with governments and civil societies to strengthen national treatment and prevention systems and help peoples around the world recover from the chronic and relapsing disease of substance use disorders, or SUD. We would not, in fact, be here had it not been for his tireless effort in leading the establishment of the International Society of Substance Use Prevention and Treatment Professionals, or ISSUP, in 2015. In 2016, he collaborated with international partners to launch the International Consortium of Universities for Drug Demand Reduction, or ICUDDR, to promote academic study around the world in addiction science. He has held other mission-critical leadership roles at the United States Department of State, and prior to federal government, he also worked at the Pan American Health Organization. His background? He earned both his MA in Latin American Studies and BS Foreign Service in International Affairs from Georgetown University. He will be our second plenary speaker. Finally, Thom Browne Jr., who holds an MA in criminal justice, is the CEO of the international organization Colombo Plan. He's an internationally recognized expert in the demand reduction and criminal justice fields, having created substance use treatment systems and prevention programs in over 70 countries and international law enforcement academies across 5 continents during his 25-year career at the U.S. Department of State, INL. Earlier in his federal career, Thom served at the Drug Enforcement Administration, or DEA, where he developed strategies, designed programs, and authored research and intelligence reports addressing the original fentanyl, synthetic heroin, and crack cocaine epidemics in the 1980s. He finished his DEA service as chief of the Latin American Intelligence Section, where he authored the Reagan administrator's cocaine strategy. At INL, Thom also supported the formation of the ISSUP and other associations. In fact, in 2014, he was a finalist for the prestigious Service to America Medal for Career Achievement in federal government. And in fact, upon his retirement the following year, he was also given a Career Achievement Award by the Secretary of State. But he's not really retired. His recent research with the Chief Medical Officer of the Department of Health and Human Services and Colombo Plan has helped redefine the opioid and stimulant epidemics in the US and regional epidemics worldwide, uncovering emerging trends in illicit drug formulation that jeopardize the health of substance users worldwide. He will be our third speaker in our plenary session. Let us now give the floor to ISSUP's Chief Executive, Ms. Joanna Travis Roberts.
Hello, everybody. I am Joanna Travis Roberts, the Chief Executive of ISSUP, and it's a real privilege for me to be here to speak to you as part of such an esteemed lineup. Thank you very much for the invitation, ISSUP Philippines, to talk to you all this morning, and welcome to the event. It's really great that this is happening, and to see this type of event coming from our national chapters is really excellent to see. We're very proud. So I will be talking to you about ISSUP on a global level, and a little bit about the background, the organisation, and the work that we actually do. So ISSUP is the International Society of Substance Use Professionals. We're a global NGO with around 17,500 members who are here to put this workforce on the map, really establish their importance as essential in the work that is happening within a country or around the world in drug demand reduction. We want to support the development of a professional workforce and really promote evidence-based, high-quality practice, policy and research that is happening in prevention, treatment and recovery care work. And we like to act as that central point, bringing together the different elements of that workforce. We are funded by the US Department of State's Bureau of International Narcotics and Law Enforcement Affairs, known to most of us as INL, who you will be hearing from today. And we really originated from a group of key organisations that were working in this field and agreed together that there was a real need for coherence and collaboration. And you can see the logos of some of those organisations here. And we were brought together as this umbrella organisation who could represent the different levels and the different perspectives of people working in drug demand reduction. A little status on where we are now. We have 24 national chapters. As I said, we have over 17,000 members now in 187 countries and territories. And last year alone, we had online events that were attended 19,500 times. So we really are gaining momentum as the organisation grows. ISSUP's vision is to create a connected, trained, knowledgeable and effective international network of substance use prevention, treatment and recovery support professionals who are undertaking and promoting high quality, evidence-based and ethical substance use prevention, treatment and recovery support. And as I said, we want to act as this central point. And when we talk about the workforce, when we talk about work that is happening in the drug demand reduction field, we include every element of individuals or organisations and groups that are working within that. So that might be a family member, a volunteer, a youth worker who has a contributing role to some prevention activities, all the way through to those that are perhaps working in treatment centres and it's their entire 9 to 5 to undertake drug demand reduction focused work. And we realise that there's a huge range of individuals and professions that are involved, and we want them all to consider themselves as essential and important and contributing to the drug demand reduction field. Another way that we like to make a connection is to really interlace research, policy and practice so that the three can meet, discuss, influence each other and learn from each other to make sure that we are all three feeding into each other's work. ISSUP works very closely within a number of organisations. There is a group team of organisations and international organisations that work together. We have a particularly close relationship with ICUDDR, who are the International Consortium of Universities for Drug Demand Reduction, and the Global Centre for Credentialing and Certification. And between the three organisations, we support the training, the education, the further education of professionals in this field, as well as then moving on to credentialing and certification. As a membership organisation, ISSUP welcomes members on 4 different levels. We have a student membership level, which is for anybody who is studying currently and undertaking any field or training which is related to drug demand reduction. A regular membership, which is for anybody interested. They don't have to be a professional, but anybody interested working in this field. The professional membership is for those who work in positions such as teachers, social workers, general practitioners who may not be spending their entire time focusing on drug demand reduction, but do have a role within that. And then drug demand reduction professionals who are focused and qualified and experienced within the field. So how do we work? How do we deliver our mission and work towards our vision? We have 3 channels. We work digitally, so we have a large website, a lot of online presence through social media and our newsletter. We have our events, which take place both in person and online. And we have our national chapters, which really allow us to deliver the mission on the ground. So moving first to our website, it's an extensive platform currently available in 5 languages. We have a knowledge share, which is where people can contribute news of their work, latest research, really important resources, and ISSUP also generates a lot of content too there. So it's a continually moving library of the latest findings, news, and resources that from the field. We have networks where people can come online to talk to each other in particular subject groups or on a larger scale, perhaps within their country, to just be able to have chat and connect with each other digitally. Professional development section, which signposts our members to key professionalization tools, resources, training, events that might be happening that are of use to them. We have a calendar of events, so anything that's happening around the world which could benefit the field, so conferences, webinars, meetings, etc. are posted on the calendar. A section of the website just goes into detail of all of our national chapters, so they each have their own mini site within our website, plus a section which talks about ISSUP and who we are and gives a little bit more information. And then the red hexagon that you can see here, which is the My ISSUP section, where an ISSUP member can go in and edit their profile, connect with other members, and really sort of look at the website offering from their own perspective. A lot of these sections can be contributed to by ISSUP members themselves, so we encourage you to come and join a network, chat with somebody, submit a piece of information to the knowledge share, and just see what we do have there on offer. We, as I said, have extensive social media platforms, so that's continual conversation that we can have online via a different platform and really communicate the latest things that are happening within ISSUP. So moving on to national chapters, you can see that we have a spread of national chapters, and these national chapters really allow ISSUP to deliver our mission at a local level within the relevant language, culture and context. And each national chapter undertakes slightly different work depending on what is needed, what the workforce within that country are wanting to receive and what already exists within that country. This national provision is excellent in allowing us to tailor and adapt for each workforce, and it allows us to penetrate and engage more members. some national chapters undertake their own independent activities. Some are using the global elements that we have on the website or in our events to make sure that they're well communicated within their country. At the moment, we have 24 established national chapters, 4 in process, so it's a constantly growing family. And this is just a little sample of some of the activities our national chapters did last year. So there were trainings, webinars, meetings, focus newsletters, and all of this is done through their own channels or on the ISSUP website or our event platform as well. So ISSUP events, you can see we have a history of those happening in person, but then from last year we moved to online, and this was our first virtual conference, and it was an excellent opportunity to reach out and engage with more people. We're very excited to be planning our next outing in Abu Dhabi in February 2022, where we will blend our learning from how we've started to hold our events online with the experience we have of in-person events and have a hybrid of the two. Just to give a little bit more information about our first online conference that was undertaken in partnership with a series of organisations that are listed here and was coordinated by ISSUP South Africa. And we held it over a period of 2 months. We had 6 focused sessions with excellent speakers. We had on average around 1,000 people attending each session. So we're delighted by the impact that that event had and the amount of interaction and the number of questions we had in each session. There was real excitement. So we were delighted to see that format work so well. And you can see here just some little images of some of the events that were held online last year by us and by our national chapters. As I said at the beginning, we had excellent participation throughout the year. We had online events in multiple languages, on multiple platforms, and every single online event is recorded and put on our website. So it's there as a resource to continue to be accessed by people, even if they couldn't join us live. And we really do cover a range of subjects. And it's, you know, upon that success, we have events like this one that are happening in the Philippines and can now go out past those national borders and allow other people to see the work here from that in-country experience. So that is all for me to say. Thank you very much for listening. And again, thank you very much to ISSUP Philippines for extending the invitation to me to speak to you all. I welcome you all to join ISSUP, to come along, share things on the networks, talk to us, bring along other people within your professional network, and link with us on our website or via social media. And we very much look forward to welcoming you to the family.
Joanna, for that invitation, and we hope to gather more after this conference. And now the very dapper head of the Bureau of International of INL, could not pronounce the entire thing, Mr. Brian Morales, welcome.
Thank you so much. Hello everybody, good evening from Washington DC. It's a pleasure to be here with my friends from the Philippines today, with whom I share so many happy memories. My warm virtual greetings from the United States. I hope that you and your families are all well during these difficult times. Today, I'd like to update you all on the latest developments in our global efforts to address substance use. Before we start the slides, I wanted to say that our program was not built by INL alone. In fact, the Philippine prevention, treatment, and recovery communities have been chief architects of the global drug demand reduction system that we have today. The Philippines is consistently the country with the most, or second most in some cases, trainers, trainees, credentialed professionals, ISSUP chapter members. You all established ISSUP Philippines before ISSUP established ISSUP. How did that happen? It's just a tremendous foresight that you have all had over the years. And now, of course, the US, as in the past years, is very committed to working with the Philippines to address substance use. The fact is, we care about your children and you care about ours. And as a global family, we have come together to tackle this transnational threat that permeates so deeply and so painfully in all of our communities. We've built what I would call an ecosystem consisting of key partners, many of whom you've heard of today. We work a lot with international organizations, as you know, the African Union in Africa, the Organization of American States in the Western Hemisphere region, the Colombo Plan, UNODC, and WHO around the world, including in Asia, and then professional international associations such as ISSUP, CADCA, and ICUDDR, who you've heard from. And another one that I'll discuss tonight, which is the International Consortium of Universities, the International Technology Transfer Centers, or ITTCs. Another key partner, of course, is also our governments that we partner with throughout the world. And so in particular, I'd like to recognize the decades of partnership with our friends at DDB and DOH. Each partner is contributing to this global infrastructure which supports this community of practice. So let's begin, and if we could go to the next slide. If we could go to the next slide, we're going to start with the first area of our work plan. Who is best prepared to prevent and treat substance use disorders? Well, that would be the workforce. And INL specializes in developing a lot of curriculum with our international partners. Here's where we are over the past decade, thanks to also the vision of Thom Browne and working with him, alongside him over many years. There are 3 curriculum series that we have now with the universal curriculum that we've discussed, the Prevention, Treatment, and Recovery Curricula Series. We have over 121 courses, totaling 2,600 total training hours. We're in our 4th edition in many of the curriculum manuals in 24 languages, training in 69 countries, and have built a network of 177 training providers. So what are our plans for this coming year? We are updating many of the courses that need new additions, particularly the basic UTC series, and looking at a couple of the advanced courses. We will be updating these courses and uploading them onto the ISSUP website, which is our central repository for all curricula of the Universal Series. That's where all education providers and all our Philippine partners can access those materials. Second, we are going to be updating the Global Master Trainer Directory. That is the directory of global master trainers. There's a new process that we've installed with partners at UNODC in Vienna and Colombo Plan, helping us in terms of additional trainings and skill development, and then sort of culminating with this database of global master trainers. Third, we are going to be working on updating the list of training providers and also expanding that list and making this better publicized. If we could go to the next slide, please. I also wanted to discuss that another innovation for this year is that we are developing online training. We've been working on it for some years now, and the first type of online training that we're doing are self-guided courses. We're working with a company out of Atlanta, Georgia by the name of Banyan, and they are transforming, first and foremost, the Universal Treatment Curriculum Basic Series. And this is course number 2, which is the Continuum of Care, is being transformed first and foremost as the first self-guided course. These courses will earn credit hours of education by GCCC through Colombo Plan for the purpose of credentialing. The courses have quizzes. They're also very nice because they integrate this international component of substance use being international, multifactorial, affecting people in all countries. And so there's case studies that relate to different countries. And there is a sort of running thread throughout the whole course where you are building sort of a patchwork of skills and experiences and knowledge that that sort of end in the fabrication of a quilt, and it's very, very nice stylistically, the design. So these are the self-guided courses. These courses will also be available to download for countries that have low bandwidth, and then we'll find a way to disseminate these at sort of scale, so that we can actually reach remote and rural areas as well with poor internet connectivity. If we could go to the next slide. We have another type of online training, and this will be trainer-led trainings. And we are working with ISSUP, which will have the training hub for these courses, in partnership with Healthy Knowledge, which is a website of the Addiction Technology Transfer Centers in the United States. What we are working on right now with a network of about 8 or 9 different institutions around the world, including a couple from the Philippines, is transforming the courses from manuals into these online courses that will be synchronous and asynchronous as well. We have already pilot tested a couple of courses, and we hope to start launching these courses later on this year on the ISSUP website. Eventually, what we're hoping is that international organizations will be contracting trainers from our global pool of master trainers to disseminate these courses regularly, and education providers, training providers could also in the future develop their own courses or deliver these UTC, UPC courses as well, and create multiple instances of these courses to run. I'm really hoping that this process will become automated, that will be driven by demand. So there will be courses that will be set up and international classrooms of students from around the world that will be able to register for these courses and take them at their convenience at different convenient times of the day for them. If we can go to the next slide. Now I want to talk about examination and credentialing. This year, we are looking at strengthening the online proctoring system that we've been looking at and pilot testing. And we think that this is important for because of the COVID pandemic, of course, but also because I think we'll be able to reach a much broader audience of examinees around the world. So we're hoping that we can get both the refresher course as well as the online proctoring prepared in a virtual format to be able to reach a broader audience that is ready for credentialing and be able to meet the needs of all of these candidates. We're also launching a prevention exam this year and a prevention certificate after many years of collaboration and work. So we're very excited by the work that UCCC has done with prevention experts and the OAS as well, which has been working very intensively in preparing for this exam. And we hope to launch it soon as well this year. We are also looking to expand the GCCC Commission and to expand the power of reciprocity, which is developed by governments recognizing the GCCC credential. And here to speak to our Philippine friends, it's also very important in having the government of the Philippines adopt the GCCC credentials, which is something that we've been discussing for many years with the government of the Philippines and the civil society networks and organizations that we have. And we hope that through consultation processes, through our partnerships, and also in consultation with the PRC and regulatory bodies and legislative bodies in the Philippines, that there will be that final impetus, the effort to bring about the recognition of credentialing of treatment and prevention professionals as well at some point in the near future. So this is an effort that I hope the ISSUP Philippines chapter will also take on in their consultations with the government. If we could go to the next slide. Quality assurance, very important. It's not only important to professionalize and train the workforce, but also top down to ensure that there is good quality in terms of the services that are being provided. Many years ago, INL, as many of you know, supported the development of the international standards for substance use treatment, which UNODC and WHO took on and led and developed. Based on that, there is now a quality standard. And on that quality standard, we have now questionnaires, processes for governments and governmental agencies or private bodies to go and to evaluate the quality of treatment programs. And these are very generic and universal forms, but what happens is through this UNODC program, they are tailored and adapted within countries so that it really adapts to the system, to the standards, and to the to the way that the governments are able to monitor, oversee, and regulate the treatment system. This year, we are hoping to have a UNODC global meeting of quality assurance agencies. Of course, the Philippines must be part of this meeting. We're very excited by bringing together the different agencies for the first time in the world, bringing together a global community of accreditation agencies to see if we can develop this common global standard and we can have this adoption based on these international standards that were just released at the last CND in March of last year. Then in late 2021, the Colombo Plan is going to be working with a select group of these agencies that have well-developed systems and that want to join an international consortium of quality assurance agencies, much like we have ISSUP and ICUDDR and the ITTCs that I'll discuss. We also hope that in this year or early next year, we will be able to launch this other group, the International Consortium of Quality Assurance Agencies, which will be working toward the development of a single global standard for the quality of treatment programs. And so countries around the world that are able to, that sort of join this consortium and evaluate treatment programs across this uniform standard would then validate that these centers in different countries all have the same sort of level of quality assurance. And this is also something that many quality assurance agencies have discussed in the past. We've been very interested for many years, and finally 2021 is the year where a lot of these pieces are coming together. If we could go to the next slide. Now I want to speak about international technology transfer centers. This is a very important innovation for INL this year. Some of you may recall that the Addiction Technology Transfer Centers of the US, which is the way that there is training, dissemination of training and education in the United States around the issue of substance use. They formed an international network through our Department of Health and Human Services, SAMHSA, a few years ago that was focused more on HIV, but it included countries like Vietnam, Ukraine, and South Africa. That program has ended, and what INL has done is sort of bring these countries together and also add Colombia and Peru and form a new network, which is the International Technology Transfer Center Network, so that all of these countries can focus really on substance use in a different and unique way. The idea here is that we want to take a systems approach. Of course, we do UPC and UTC and other trainings, but a systems approach really means that we work to identify physically within a geographic area like a city, where are the treatment programs? Where are the services? Where's the aftercare? Where's the prevention services taking place? Where are the gaps and the barriers that prevent people from accessing services? A lot of mapping and understanding how the entire system works. Is there a diversity? Too much outpatient, too much inpatient? Is there a good balance? We know that treatment is not uniform for everyone. There needs to be a diversity of services and a diverse network to support people that are in recovery or just leaving treatment. So it's very important to have a very top-level systems review of how a treatment system and a prevention system are designed within a geographic space like a city or a province or nationally. So the goal of this program is to have a network of universities from different countries. And so the university is sort of the unit of analysis for the ITTC. I hope that the Philippines will also join in due course this network. The idea would be that a university would be designated to serve as the ITTC, connecting with all of the other ITTCs around the world. They would share mapping tools, conduct analysis of drug use, of crime drivers. What are the drivers for substance use and crime in communities? How do you integrate services to address these individual drivers? So in a sense, it's a very comprehensive and yet targeted way to be able to drive down the numbers of drug use and crime. And certainly UTC, UPC, quality assurance, all of these sort of efforts are important. It's just a strategic way of identifying how best to introduce these in the communities, and also developing recurring data collection systems. So how do we, through some of our programs like alternatives to incarceration, how do you build data collection systems that tell us when these indicators, when these metrics are sort of yielding results. And so that is part of the work. Who are the customers of the ITTCs? They're actually the governments. The governments are the recipients, and the ITTCs coordinate with government stakeholders and civil society organizations to help explain the design, but then also to help governments in advising how best to utilize resources to have a very comprehensive system so that we don't have those gaps. There's a couple of ITTCs that are also self-funding because INL has limited funds to support this. So Mexico and the United Arab Emirates are also launching this year. We expect to have our big launch event in February of this year, and again, very excited, and I hope that the Philippines will join this network as well shortly. If I could have the next slide, please. Here are some miscellaneous programs that we are looking forward to expanding or launching this year. One of our big efforts in INL and my office this year is to conduct a very in-depth program, a 5-year evaluation in the city of Pereira, Colombia. Pereira, Colombia was selected as the city after a very long process. And the goal is going to be to use the systems approach over 5 years, looking at total population-wide drug use and crime levels, and seeing if through an integrated intervention of multiple actors, multiple agencies, and multiple prevention, treatment, recovery interventions, we can drive down the entire population-wide drug use and crime numbers. And that is an innovation, and it's different because typically what we do is we work with a specific sample size, and we track a certain number of clients through treatment and post-treatment, and then we see what the relapse rates are, what their quality of life improvements are. But in this case, we're looking at the entire population, at the totality of the number, which is very ambitious. And so this is going to be an area that will help validate a systems approach, which we know is we know from other research is very important to approach drug use from this perspective. But Pereira will be INL's test case to implement this in great depth. And then in the other cases of the countries I mentioned, it will be at the national level, so not quite to the depth of one city and sort of integrating all of these services in one place. Second, I want to also mention that we are very focused on the issue of alternatives to incarceration and looking at how the criminal justice system, law enforcement, judiciary, and corrections can address and really be partners in the area of addressing substance use. And this network of partners that we have with Colombo Plan, UNODC, the Organization of American States, and other partners have developed a process by which countries can join this program to sort of visualize, conceptualize what type of activities we could introduce to help people move out of the criminal justice system and into treatment and recovery. And there's a tremendous amount of science and enthusiasm. There's a mandate from the UN General Assembly's special session on drugs to address this issue. And we are very excited. We have seen progress in many countries, including in the Philippines in this area, and very excited to collaborate with you all on this program as well. Youth Forum and Youth Congresses. The Philippines is one of the leaders in the youth forums and youth congresses of the past through their work with the Colombo Plan. Unfortunately, I wasn't able to attend the Philippine Youth Congress, but in Palawan some years ago, but I know that you've all had wonderful youth congresses over the years. Well, now we have a curriculum, and we formalized this network and this forum with greater detail, and we are excited that this is all coming together this year because we're hoping to have a large youth congress next year during the global ISSUP meeting that I'll discuss in a minute. But we do have a curriculum that we are in the process of finalizing, which will be pilot tested, peer reviewed, and we look forward to sharing that with our partners in the Philippines so that you can all also utilize this for your youth congresses as well. Fourth, we're going to have a dialogue this year with law enforcement and school prevention experts, prevention scientists. There is a discussion, a debate in the field globally, which we keep coming across country after country, including in the United States, on what the role of law enforcement should or should not be in schools. And there are many countries where police officers work in schools with youth, to do a lot of anti-drug prevention messaging and campaigns and activities. And so the question is, to what degree is there evidence and science, and what are the best guidelines or advice that the scientific community could provide to law enforcement officers in developing school prevention programs? There is actually a lot of good research out there. And so UNODC out of Vienna, Austria, Joanna Campello and her team will be hosting this dialogue along with law enforcement officers from around the world and prevention scientists from around the world, many of whom are already engaged in schools. And we hope that the product that will come out of this will be a set of guidelines or standards that will be useful for law enforcement officers. I think there's a lot of promise in this dialogue to help bring the community together and to bring some much needed clarity to the best ways to engage between these two communities. Finally, I will say that the other program that as Eric mentioned, CADCA, all over the world has just been amazing in their growth. It's just sort of exploded. It just keeps replicating and reproducing. There's so much enthusiasm around the world for CADCA. And we're hoping that we can move to a model of mainstreaming CADCA across entire countries, looking for partners where a training of leaders forum, which we've done, and format which we've done in many countries, including in the Philippines, can lead to national adoption of a coalition model where there is ownership by sort of a central group that then takes on the role of expanding and sort of making sure that communities that are more remote, that have more challenging issues with drug use, can also establish their coalitions, have them thrive, and have them really connect to a support structure in countries. So mainstreaming CADCA coalition programs is also a big priority for us this year. And I'd say that the Philippines is right up there among the countries that is really in a great position with Dr. Tolentino and so many of the other great partners of CADCA to really sort of mainstream this and expand CADCA throughout the whole country as they've been doing over the years. If I could go to the next slide. Now I'm going to conclude with the ISSUP Global Conference, which we are planning for February 7 to 12, 2022. And we are looking we are partnering with the National Rehabilitation Center in Abu Dhabi. Many of you may know the NRC, which has hosted many trainings and events over the years. Dr. Hamad Al-Ghafari and his team. We are very excited by this opportunity, partnering together to support ISSUP in their global conference. This conference we are hoping will bring thousands of people together. It's very ambitious. There's a lot of unknowns. Will we be ready for in February 2022 amidst the pandemic? Will it be mostly resolved? Will people feel comfortable traveling? Will it be easy to travel? These are all unknowns at this stage. We'll get a better sense as the date approaches. We hope to have some type of face-to-face conference. The original estimates had been for thousands of people, but we are hoping that if things turn out well, that we will be able to have a very large presence there from the international community at the ISSUP Global Conference. This will be I think one of the most impressive venues that we've ever had for an ISSUP meeting, and the amount of conference space that we're going to have over 23 events, I think, at last count. And we will also be partnering with many other organizations, including WAPR, which is an association of psychologists. And so there will be a very large network of professionals that will be there on site, including booths and all kinds of other activities that will take place around plenaries and other gatherings. So we're looking forward to this event. Now, what will make this conference unique is that we will not only have a face-to-face conference, we're also going to be planning a virtual conference. And I felt in past ISSUP meetings that it's been exciting to see so many people, and yet it's been a bit sad when we don't see some of our colleagues and friends from around the world because they weren't able to make it for so many reasons. So we're hoping to also be able to have a virtual conference that will run throughout the days of the global conference. And knowing how ISSUP is always dreaming big and always doing great things, we are contemplating actually doing a conference that runs for 24 hours a day, 7 days a week throughout the entire face-to-face conference of ISSUP, and even a little bit beyond that as well. we have the global network, we have the partnerships to be able to have an hour-by-hour conference if we count on all of you and our global partners and our ISSUP national chapter partners to be able to help us record and prepare these different sessions. And we are literally hoping that we can start spanning the world and begin in the South Pacific, and as we cross time zones, move on to Southeast Asia and South Asia and Africa and Europe and North America and then back to the Pacific. And we hope that we could actually have the global voices to really represent how substance use is an issue that transcends countries around the world, that we are all faced with, and we have all solutions and hope and optimism that we can provide and share with others around the world. There is a common problem and common solutions if we stick to those evidence-based practices. So if we're able to pull this off, if we're able to have a virtual conference 24/7, we may be able to pull off a world record. So this is actually something that's very exciting, not just for longest virtual conference for drug use, but for period, for having a virtual conference period for this length of time. This would be a world record. So we're hoping that we can make this happen. This is the discussion that I want to update all of you on. We've been having discussions with ISSUP, the NRC, and others to see if we can make this possible. And I'm confident that with all of your support, we will be able to do this. So with that, I also want to end by thanking the Philippine treatment community. There we go, there's the thank you slide. I want to thank the Philippine treatment community, the prevention community, the recovery community, our policy partners in the government for continuous support, for continuous partnership and friendship in this area. It's really been a pleasure. I only wish I could be there in person and can't wait for the day when we can all meet once again. Thank you very much.
Oh, thank you very much, Brian Morales. I assure you, I'll give you a free RT-PCR test.
Okay. Very important. Thank you.
Thank you so much. Looking forward to that conference next year.
Thank you.
So we now call on our head of our Colombo Plan Drug Advisory Program, Mr. Thom Browne. Thank you. Please proceed.
All right, thank you. Yeah, I'm not the head of the drug advisory program. I'm the CEO. That's okay. Natalie Panabog, she's the head of the DAP. She may be on here. Okay, that's okay. Okay, so you got my slide deck up. Okay, that's good. First, I'd like to thank the Philippines, the ISSUP chapter, the Philippines, the Dangerous Drug Board, U.S. Embassy Manila for organizing this pre-conference event. Okay, to get started on this, I'm going to basically, for an emerging global issue, I'm going to discuss a topic I've done with the ISSUP national chapters before and with the ISSUP global chapters, and that's basically the relationship between COVID-19 and the high risk to get COVID-19 amongst substance abusers, meaning people who use drugs of abuse such as heroin, cocaine, and meth. Research has shown over the last year that they're more susceptible to get COVID-19 and severe consequences from COVID-19. So I'm going to briefly cover that. So can you get me to the next slide, please? Okay. Although COVID-19 is usually mild and most people recover quickly, certain groups of people are at higher risk of severe illness and complications from COVID-19. That includes the elderly, people with compromised immune systems, high blood pressure, diabetes, heart problems, kidney, liver disease, chronic respiratory, and lung disease. However, people with addictions or substance use disorders, they have numerous co-occurring health problems, which make them more susceptible to COVID-19. And these include respiratory, pulmonary, and cardiovascular diseases, in addition to suppression of the immune system and chronic obstructive pulmonary disease. All of these are higher risk factors for acquisition of COVID-19 infection. So basically, there's four basic systems in the human body: the respiratory, the pulmonary, which is the lungs, the cardiovascular system, the heart, and the immune system. When these become compromised, a person is more susceptible to other infectious diseases, especially COVID-19. And research has shown that the compromised diminished lung capacity from COVID-19 places users of opioids, methamphetamine, and other psychostimulants like cocaine at risk for mortality and severe complications from the virus. This is of importance to the Philippines because I believe the main drug of abuse in the Philippines is methamphetamine or shabu. Methamphetamine is a very addictive substance, and because of the properties of methamphetamine and the effects that it has on the user, it will make the user more susceptible to COVID-19. One of the most recent and comprehensive studies that has been done on the relationship between substance users and COVID-19 was completed by the National Institutes of Health in the United States this past September 2020. It's the most recent study on COVID-19 and drug users. It analyzed millions of COVID-19 patients in U.S. hospitals, both those with and without substance use disorders. And it found out that those with a substance use disorder were more likely to contract COVID-19 and have worse outcomes from the virus. That includes hospitalization and death compared to those who did not use substances of abuse. This is particularly explained by the fact that the lungs and cardiovascular systems are often compromised in people with substance use disorder, which putting them at high risk to obtain COVID-19. And another contributing factor is the marginalization of people with addiction, which makes it harder for them to access healthcare services. Going to have the next slide. Okay, what I'm going to go over is some drugs of abuse, mostly pertinent towards the Philippines and the properties or effects these drugs have on the user that can make the drug users, especially those people in treatment, that if you're people in the past that use certain drugs extensively, certain drugs will make them more prone to get COVID-19. Okay, methamphetamine users may be vulnerable to COVID-19 due to the drug's effect on the respiratory, the cardiovascular, and the pulmonary systems. Methamphetamine or long-term methamphetamine use, severe methamphetamine use, will affect these three critical systems that will make a person more susceptible to get COVID-19. Okay, methamphetamine causes pulmonary damage, pulmonary hypertension, and chronic disease of heart muscle, all high risk factors for COVID-19. Pulmonary hypertension, that's basically a type of high blood pressure that affects the arteries and blood vessels in the lungs and the heart. What happens is the heart pumps blood to the lungs. But what happens is the arteries and blood vessels from the heart to the lung become narrowed or constricted, making it very difficult for the heart to pump oxygen-bearing red blood cells to the lungs. And so what happens is that results in increased high blood pressure, which is a high risk factor for COVID-19. And also it puts significant stress on both the cardiovascular system, the heart, and the pulmonary system, the lungs. And the more damage you do to these two systems, the more susceptible a person will be to COVID-19. Okay, next slide, please. Okay, the second most used drug in the Philippines is marijuana or cannabis. And research has shown that both marijuana smoke and e-cigarette vapor are associated with inflammation of the airways, similar to that observed in patients with COPD and with the development of bronchitis and asthma, all of which are shown to increase the risk of severe complications and mortality from COVID-19. Okay, so can we proceed to the next slide? Okay, I'll briefly touch on cocaine because the amount of cocaine production has increased in Latin America, and the amount of cocaine use, especially in the US and certain parts of the world, has increased, okay? And we've seen over the last 3 years increased trafficking of cocaine into Southeast Asia. You know, alone in the last 3 years, there's been multi-ton seizures of cocaine in the port of Colombo, Sri Lanka, heading over to Southeast Asian continent. Okay, we're not sure like which countries it winds up in, but I know in the Philippines, in the various seaways around the Philippines, there's been seizures of cocaine. So we have seen that there's more cocaine heading towards Southeast Asia. And right now, I believe most of that cocaine use is mostly in high-end clubs like discotheques and nightclubs. But one of the things about cocaine that's important, that cocaine, one of the toxic effects of cocaine is arterial vasoconstriction, just like methamphetamine. It narrows those blood vessels and arteries in the lungs and the actual heart, you know, leading to increased blood pressure or high blood pressure, which makes a person at risk for COVID-19. Like we said, this is something to be on the lookout in Southeast Asia, because there's been more cocaine recently that has been trafficked over to Southeast Asia. And with this multi-ton seizures in the port of Colombo, Sri Lanka, heading over to Southeast Asia. That means there's a possible emerging problem of cocaine over there. The next slide. Can I have next slide? Okay. In addition to drugs, basically, there is more to actual drugs than the drug itself. Like some of the presentations I've done for ISSUP over the last year have been on the changing composition of drugs of abuse worldwide. It is a project that we started with INL in 2010 with the Colombo Plan that continues to this day, where we've tested the changing composition of drugs since 2010, where what has happened is the cutting agents used in drugs have gone from very benign substances like inert substances like mannitol and lactose, which are sugars that do not affect the user, to more pharmacologically active or toxic cutting agents that affect the long-term and short-term health of the drug user. The reason why these new cutting agents are popular to drug traffickers is that they have a synergistic effect, or they interact with the target drug of abuse, heroin, meth, or cocaine, to make it more potent and more powerful, in addition to extending the high. Okay, so one of the main cutting agents that's used in the stimulant like cocaine, and it is also found increasingly in heroin these days, is a veterinary product called levamisole. Levamisole is basically used to expel parasites from cattle, but what it does in humans, it depletes white blood cells. And any substance that depletes white blood cells lowers immunity in a person and increases opportunistic infections. So what happens is, if your drug is cut with something like levamisole or other pharmaceutical products like aminopyrine or metamizole, these deplete white blood cells in human. And when you deplete white blood cells, you increase the opportunity for infections in a person, and you make them more susceptible to COVID-19 and other infections and diseases. Now, the importance of this is that if you're using a drug of abuse like heroin or methamphetamine or cocaine, you're not going to be susceptible to COVID-19 right away. It takes a while for the heroin, the cocaine, and meth to affect the cardiovascular, the respiratory, the pulmonary system, to weaken that and make the user more susceptible to COVID-19. Like persons with substance use disorders or severe addictions to cocaine, meth, and heroin would be more susceptible to COVID-19 because they've used the drugs longer, and the drug has taken an effect on the pulmonary, the cardiovascular, and the respiratory systems. However, these cutting agents don't take months to take effect. They take effect almost instantaneously. So if you have a drug, if you're methamphetamine, your shabu, your cocaine, your heroin, if it's cut with something like levamisole or a cutting agent that depletes white blood cells, that's going to be fairly immediate. And your blood cells are going to start, white blood cells are going to start to decrease. And the more you use a drug that has this cutting agent, the more susceptible you're going to be to infections and diseases. It's not going to take months. It's going to take a day or a week to put your system and to compromise your system, puts you at risk for COVID-19. Next slide, please. Okay, to make this more relevant for the Philippines, where we're doing this pre-conference event, like I said, the main drug of abuse is methamphetamine. Now, methamphetamine, both in the Philippines, in Southeast Asia, in Thailand, in Myanmar, in Laos, the rest of the world, is primarily cut with a caffeine. Now, a person will look at caffeine and say, okay, caffeine is in energy drinks, it's in soda. How dangerous can caffeine be? But when you mix caffeine with a drug of abuse, such as heroin, cocaine, or methamphetamine, you get a different effect. You get a different substance. It's a lot more toxic. Research has shown that when you mix caffeine with stimulants such as cocaine or, say, methamphetamine, it will enhance the psychostimulant effects and produce additive effects between the two drugs. What that basically does, it'll make the cocaine high, the methamphetamine high, more potent, okay? So it strengthens or it increases the potency of methamphetamine and cocaine. But at the same time, it also potentiates the toxic effects of cocaine and methamphetamine. So its adverse effects on your cardiovascular, pulmonary, respiratory system, that will be exacerbated by mixing cocaine with, say, methamphetamine, not mixing caffeine with methamphetamine. That has a synergistic effect. Okay, with heroin, you mix caffeine with heroin, you're going to have abnormal heart rhythm and respiratory distress. Therefore, you're affecting the cardiovascular and the respiratory system there. Okay, caffeine is also addictive, and chronic use can lead to cardiotoxicity, which is damage to heart muscle, changes in heart rate, and cardiac injury. It also increases the long-term neurotoxicity or adverse effects on the central nervous system induced by MDMA or ecstasy. Okay, next slide. Okay. Many drug users reside in geographical areas characterized by social deprivation, high population densities, poor quality housing, homelessness, and reduced access to health care, putting them all at high risk for COVID-19. The environment where the drug is being used, in addition to the drug and the particular cutting agent, and how severe that addiction is will make a drug user more susceptible to COVID-19. Can I have the next slide? Okay, now what people who are really substance users who are really susceptible to COVID-19 are those who use drugs in a group setting or mostly open air drug markets. We have seen these, you know, the what they call the Cracolândias or the open air markets in Sao Paulo, Brazil, where they openly smoke crack cocaine, or in Durban, South Africa, where you have Wunga Park in the actual train yards where thousands of people congregate to smoke the drug concoction Wunga, which is heroin and marijuana mixed together with a bunch of cutting agents. Okay, next slide, please. Okay, in the US, we also have these open air drug markets like in the Conrail train yards outside of Philadelphia. So where people congregate and get together to use drugs, there's no social distancing, there's no masks being used, there's no personal protective equipment, there's sharing of drug using paraphernalia, such as, you know, like say crack pipes to smoke crack, or implements to smoke methamphetamine, or sharing needles to inject drugs. So basically, people, high-risk drug users that use in open-air drug markets, who use like 3 or 4 people at a time, they're also more susceptible to receive COVID-19 because of the setting that they use in drugs and the fact that they don't have any personal protective equipment or social distancing. Okay, I believe that's the last slide. Can you advance on that? Yeah. Okay, so the takeaway from the presentation I wanted to make here is that people in substance use treatment programs, if you have people that come into your programs and they have had, they have severe substance use disorder, meaning they've been using methamphetamine, they've been using cannabis, heroin, cocaine for quite some time, you have to assume that there's been some damage done to their cardiovascular systems, their respiratory systems, the pulmonary system, their lungs, and that while they were out on the street, they would be more susceptible for COVID-19. And even while they're in your substance use treatment program, because their lungs may be damaged, their heart may be damaged, their systems are compromised, immune system compromised, they would be more susceptible to basically access to receive COVID-19 and have more severe consequence or effect from COVID-19. So it's very important to realize that substance users today are at high risk for COVID-19. And that needs to be taken into effect, you know, when dealing with people with substance use disorders. Okay, and we'll find out, you know, more about this as time goes on, because COVID-19 really hit us 1 year ago, really 10 months ago, in March 2020, and there's been some significant research done then, and there's going to be more that's being done now, and every day we're finding more and more how people with substance use disorders are more high at risk for COVID-19, and also as this virus mutates, we have to watch that, you know, how that affects the effectiveness of the vaccinations, and how that's also going to affect substance users. Okay, so I'd like to thank ISSUP Philippines for the opportunity to make this presentation, and you could turn control, you know, back over to the organizers.
Thank you very much for that. We now go to the question and answer. So much learning from you, Mr. Thom Browne. Welcome,
Yeah.
Susan and
Yes, that's right, Tito. Thanks. And hi again, Malin. All exciting developments and instructive inputs. Now, thank you very much. We'd like to call on Joanna, Brian, Thom, Eric, and Michal and Olivier to please turn on their cameras for the question and answer forum. We now actually have 307 participants, but at the height of the pre-con earlier on, I counted something like 345. So we're still keeping them extremely engaged. Thanks to you. We also have very, Malene, we also have very affirming comments coming from our participants. Thank you for this great conference from George Williams and Dr. Kamal Banik. He says we are combating altogether COVID-19, superb, excellent, and very good webinar. And we have a couple of questions coming from the question box. Right, Malene?
Yeah, we have a couple. But before I read the questions, Suzanne, I would really like to say thank you very much. I really had a great time listening to all our speakers, especially with Mr. Thom Browne and Brian Morales, because I remember before I would be sitting on these conferences and listening to them. And those years back when we were just starting with the UTC training, developing all these things. And of course, the 2015 ISSUP launch in Bangkok, right? So anyway, the first question is from the Philippines. This is Armando Crisostomo. Is Mr. Olivier still here with us? Because it is for Mr. Olivier, yes.
Olivier Lermet.
Yes, I am. Just give me 2 minutes. I'm
cool.
again.
Go ahead. So he says you mentioned casinos being used for money laundering activities from income generated from drug trafficking. Does this include the Philippine offshore gaming operators that are predominantly Chinese owned? We have that as a problem here, the POGO in the Philippines. So, Mr. Olivier, please.
Sorry, I'll put the webcam in a second, but well, we are precisely assessing this not only in the Philippines. We are doing an update on to what degree this is connected. In all honesty, the odds are very high, but we'll share the evidence when we get it. Over.
Okay, thank you. Our second question is really for any one of the panelists. We have, again from the Philippines, Serge Musni. Any research on alcohol consumption in relation to COVID-19, since alcohol is legal? Plus, of course, it was mentioned earlier that people shift to alcohol during this time, during the pandemic, right? So is there any research? Anyone
I
from
haven't
the...
seen, yes, most of the research I've seen that gets sent to my inbox is on drugs, heroin, methamphetamine, cocaine, and its effect on COVID-19. But you have to assume, because since alcohol affects the liver, you're doing damage to any body organ, that if that's compromised, your liver, your lungs, your heart, a person is more susceptible to COVID-19. So yes, a person with an alcohol disorder where you have severe liver dysfunction, common sense says yes, because you have a weakness in the actual liver, a pre-existing condition, like people that have diabetes, high blood pressure, you have damage to a bodily organ, you're more susceptible to COVID-19. That if you have that damage to your liver and other parts of your system, yes, you could be, I assume you would be more susceptible to COVID-19.
Okay, thank you very much. I think we only have 2 questions. Anyone wants to add?
Yeah, to add shortly to what Thom just said. We know that when the immunity battle starts in the body, right? This is one of the phases of COVID. The white cells are essential. And yes, we have, as Thom was saying, number of good reasons to think that this will affect the white cells, hence the immunity to lead that battle. Over.
Thank you.
Great. Thank you to your responses. Malene, are we going to ask another question, or are we going to turn over to Gina?
Yeah, maybe before we go to Gina, I'd just like to say that what I see also as a silver lining for us in the helping profession is what I heard from Mr. Brian Morales. So many online courses because of the pandemic. It's
Absolutely.
easier for us to access, and of course, it's cheaper. We don't have to travel. So thank you for that. Really, thank you.
Yeah, he called it the very systems approach, and very innovative indeed. And the global infrastructure and the community of practice is certainly thriving. I'd like to ask just one more, and it's like anyone, one or two amongst you, since you started on the silver lining, what is that one silver lining that really gives you optimism and hope going forward? Perhaps Michal, if you can.
Anyone?
Sorry, Susan.
Anyone? He's
Dr.
not here
Michal
anymore.
not
Oh, I
here.
see. All right. Okay. So anyone, I think, who's Brian, please. What is that? One silver lining that really keeps you optimistic and hopeful.
So the one silver lining is before the pandemic, using these types of communication platforms, it seemed to be impossible. Every time we tried to organize a meeting, and we were always traveling, and oh well, if we don't travel, we can't do anything. It has to only happen if it's face to face. And the speed at which we've been communicating, I feel like this past year we've all been locked up, and yet we've been advancing so much in our programs. A tremendous amount of meetings. Of course, I felt too many meetings up to a certain point. I end the day exhausted. The commute of work, the hours of traveling are gone, but they're now work hours also. So, I mean, there's a lot socially that I think we all have to reconcile. But I think that the way that we've all come together as a field, it hasn't been, let's give up and let's, disconnect from the world. In fact, I think the treatment, prevention, recovery community of professionals in ISSUP, they've redoubled their efforts. You just have to look at ISSUP membership, look at the number of webinars, look at the number of engagement activities. It's just been a tremendous explosion of activities and energy and enthusiasm. And the silver lining for me is, as things sort of, hopefully we reach a new normal coming out of the pandemic, this isn't going to go away, but I think we're going to work a lot smarter. And I think in the future, the way that we do our programming will be different, because I see that a lot of our training will be online in the future. And yet we will still travel, we will still get together, but maybe we're going to do things a little bit differently. Maybe the travel is going to be for technical assistance or for more in-depth work, more smaller technical groups doing technical things on the ground. And so I think if there's a silver lining for the pandemic is that it's going to make us work a lot more efficiently in the field. We know we can do these types of communications. We know we can engage this way. We know that we can get a lot of work done here. We used to have treatment expert advisory groups and peer review groups. We can peer review courses as they finish. We could peer review them. We don't need to wait for one moment of the year where we all come together. I think we'll be able to use our resources more effectively, and we'll be able to get a lot more work done thanks to these new ways of communications that have now just become a natural part of our work environment.
Excellent. Thank you so much all for your insightful and inspiring inputs. Indeed, if we work together, nothing is intractable. Malin?
Yeah, Mr. Olivier wants to say something. You raised your hand.
Sorry, I don't want to monopolize the airtime, but there is something I didn't mention in my presentation, and I think it's another silver lining. There have been a lot of different views, controversies over the war on drugs, right? The campaigns against illegal drugs at different levels. And well, what is very interesting, and this is very unique to the Philippines and the United Nations, is that there was an agreement to work together on the issue of human rights promotion in the country. This has been sanctioned by a UN resolution in Geneva. This is really high level from the Philippines. So this is a process that is starting, right? And this is a discussion. This involves the government, the United Nations, and the civil society. And in that process, one of our shepherd role is, of course, to be a technical convener and leading partner in the drug component, right? So we cannot expect now how this will evolve, but that is really something to be noted, right? In many similar situations in the countries, the country closes the fence and some people are closing their good principles. Well, here we're just trying to address things together. We know there are so many considerations leading to a balanced drug policy that is respectful of human rights and that will promote a proper public health response. But I think that's worth being shared. And of course, at any stage, it will involve so many of us. So over.
Thank you.
Okay. Are we moving on to the reflections, Susan?
Yes, yes. You introduced Gina.
Okay. So at this point, I'd like to introduce someone who is really known to her friends and colleagues as Gina. So she's going to be giving us the reflection and summary of the plenary, the topics during this first plenary. Mr. Regina Hechanova-Alampay is a full professor and licensed psychologist and the chief of party of the USAID Renew Health Project. Gina was formerly the chair of the Department of Psychology at Ateneo de Manila University and past president of the Psychological Association of the Philippines, that's PAP. A prolific researcher, Gina was named one of the outstanding youth scientists in 2005. Gina has always been active in outreach, making sure that mental health services are provided for those who need it most. For her efforts, she was named Outstanding Women in the Nation Service in 2010, and in 2018, Outstanding Professional in Psychology for the Professional Regulatory Commission, that's the PRC of the Philippines. So now I give you Gina Hechanova to give you the reflections and summary of today's topic. Gina?
Hi. I know people are hungry, so I will try to make this really quick. It's really hard. You gave me such a hard task of trying to summarize. But Kath, may I ask you to share my slide, please? I just have one slide, so I know people are hungry. And what I just tried to do is sort of just reorganize everything I heard today. And I'm clustering them into four themes. Right? So one is shift. How COVID especially has shifted our situation. So we heard from Olivier how the drug of choice in many parts of the world has actually shifted to meth. And Thomas also talked about how the drug itself is changing and the composition as manufacturers have become very adaptive and creative as well. We've talked about how the transfer of drug production has changed and even the distribution of drug production has changed. In the Philippines, we talk about now how you can actually get drugs via Grab or you can have it delivered in your own homes, right? Olivier also talked about because there's a lot of, for example, incarceration because of COVID, non-compliance, so our already overburdened criminal justice system has even become more overburdened. And now we actually have issues of COVID in the prison setting. There's also a discussion on how COVID itself has increased poverty, violence against women, unemployment, drug production, and substance use. Thom also talked about the vulnerability of PWODs, both from a physiological perspective because of the impact of drug use on the body, but also from an ecological perspective because of the poverty and lack of jobs and spaces where they cannot get access to safety equipment. Also talked about how what challenge has been the lack of resources to deliver treatment because of budgets that have been transferred to COVID response, because of the lack of access to technology or even connectivity. And Eric also talked about how many of the coalition personnel have shifted to actually delivering COVID-related response, which is both good and bad, right? We also talked about the slowing down of drug treatment services, as well as for certain areas, the lack of access to drug education and training. The third theme, and Malin called it silver lining. I just termed it the adaptation. So how have we changed, in terms of how drug treatment is being delivered? On one hand, I also wanted to cite that other than the rise in the virtual approach to education, to treatment, even to research, we're also seeing how the drug abuse coalitions themselves are adapting and responding. So we're seeing, for example, them also delivering mental health services. So that kind of synergy is actually good because on the ground, that's what we want to see, an integrated delivery. Many of the speakers today talked about how, yes, we do need resources. We also need perhaps to think about a more integrated way of delivering substance use and mental health, especially in the Philippines where it's still sort of siloed, or there are parallel efforts, but it's not really an integrated effort yet. Eric talked about strengthening networks and working synergistically. And we know that in the Philippines now, we have great coalitions, we have very active government agencies. I think we just need to learn to work together better and with greater synergy. Olivier also talked about the need for greater advocacy to address stigma and discrimination, and for policy reform to really shift in the country. Well, we all know that our policy is not yet penned from a public health perspective. So we need to be able to do that and to be able to institutionalize, especially community-based drug treatment. Michal and Joanna also talked about the importance of evidence-based policies and treatment, and how there's a need for greater research. And that also brings me to the point of the need for greater synergy between academia and perhaps our treatment community, because we do need more work at this end. It's also very exciting to hear many movements, especially from Joanna and Brian, in terms of bringing online conferences as well as education programs, as well as the efforts to embed drug treatment in the Philippine educational system. That's, I think, one of the biggest gaps for us. There's not a lot of schools with formal programs or courses yet on drug treatment. And I think that's a big challenge for us if we want to continue working the field. So many shifts we're seeing, many challenges, but we're also seeing a lot of adaptations or silver linings. And we really have our work cut out for us, but hopefully with greater synergy, we can do this baby steps, but moving forward one day at a time, one step at a time. Thank you. Back to you, Malin.
I think we need to have Tito and Cheat for our tokens.
Yes, Tito, where is he? Yes, hi, we're back. May we have all the presenters to turn on their videos? Yes, thank you. Tito, can you do the honors?
Yes, the certificates of appreciation are hereby presented to our panelists and our rapporteur for in grateful acknowledgement and appreciation for having served as a resource speaker during the ISSUP Philippines pre-conference event, Issues and Realities of Addiction and Behavioral Health, the Global Perspective, given this 27th day of January 2021 in the Philippines, by yours truly and our president and chair, Teresita Castillo.
Yay! Thank you.
Right.
You will get your virtual certificates through your email, and maybe an Amazon gift card care of Thom. No, just joking.
Virtual money. Colombo
Yes.
plans, you get virtual money.
Virtual, yes. All right. Okay.
How about a virtual visit in Baguio?
Okay, that too. Once we get our vaccinations, right? Once we all get the vaccine
Yeah.
out.
I'm with Red Cross. It's for free for you.
Oh, I'll come over and get it. I'm supposed to wait 2 weeks to get it here in Arizona. I'll come see you. I'll get it faster. But I'll pick up COVID on the way on the flight. You know what I mean?
Okay, Tita, can you just run through the campaign for our volunteers?
Yes. As we all know, ISSUP is a volunteer organization here in the Philippines. We are again repeating our call for volunteers for 2021, as we have so much lined up to everyone who wants to be in the helping profession, to make a lasting difference in the life of others, to enable and empower ourselves, participate and learn from a global network of professionals, as you have witnessed this morning, to be part of a movement and journey, to have ready access to reach knowledge, resources, and substance use prevention, treatment, and recovery support community. So all you need to do is enroll at issup.net and go to the Philippine chapter site to apply, which you will do by email, and we shall evaluate and accept you as a member of the Philippine chapter. Then you send your CVs to cheat.isuphil@gmail.com. Applications will be has to be submitted within this month, and we shall announce all the accepted applicants by January 29.
Yeah.
That's it.
Okay, so all right, well, we're 12 minutes beyond 1 o'clock, so just a little more time just to put everything to a close. Time is always not on our side when we have such powerhouse speakers. You know, I'm really very humbled to have everyone here today. Such wealth and depth of information, insights, and perspectives on the emerging realities and issues on addiction amidst this pandemic. A whole lot of lessons learned from how our global stakeholders are able to overcome the challenges of our new normal. When we talk about the silver lining, which we've really talked about a lot earlier, we have the beauty and benefits of technology. It is for us being able to gather here today across and beyond borders. Like what Brian said, it would take like heaven and earth for us to get together for just even a meeting. But of course, with ISSUP, we are able to connect, unite, and share. So with that, I would like to express our appreciation to all our participants, of course, from the Philippines and from all over the world, for taking time out of your busy schedules and duties to be with us here today. I know it's past lunch for the Philippines, and for Thom and Brian and maybe Eric, it's past your bedtime. So thank you. We hope you have learned as much as we did for our day one, and we look forward to having you again tomorrow for the presentation of the same theme, but on a national level. We have an equally power-packed speakers from the different government agencies like the Dangerous Drugs Board, the Philippine Drug Enforcement Agency, the Department of Interior Local Government, the Department of Health, and the Philippine National Police. It's going to be another interesting day. So with that, we bring our first day to a close, and thank you all again for your participation. Keep safe and be well. See you all tomorrow. Thank you. Before we end, can we all have a group photo with everyone? Kat, can you maybe take out the slide so we can have everyone on screen?
Hi, Gina.
Yes, thank you, Gina. Okay, Diana, hi again. Okay.
Hi, Diana.
Okay, one more shot. Okay, one more. Okay, thank you, everyone. Thank you. Good night.
You're welcome.
Brian, Thom, Eric.
Good night.
Thank you so much.
Yes, thank you.
Good night.
Enjoy your lunch.
Take care.
Bye.
Bye. Bye. Salamat. Maraming salamat. Thank you. Thank you, Olivia.